Hi, it's Graham Barr, just joining.
I'm not seeing the screen. Never mind.
Sale, sale.
Ebenezer,
Yes, Wayne.
it's saying that I cannot turn on my video because you've stopped it.
No, I don't think not just you, but most people.
I did not stop the video.
But he hasn't stopped it. I think it's a technical glitch here that we're trying to resolve.
Oh, okay. No, because it's just a meeting alert that says you cannot start your
Yeah,
video.
he's telling me the same thing. Yeah.
When you set up a meeting, it requests whether or not you want your participants to have video. So the issue must have happened when the meeting was set up.
Yeah, although this is not the first time we've done it, but in any event, so we'll see what gets corrected.
I have another technical question. How does a community board member who also is a member of the public speak during the public session? How do we alert you to get on the
The
list?
community board members are not supposed to speak during public session. Members
What
of
if
the
we're
public,
speaking on behalf of organizations that we had?
then you sign up for the public session part.
Right, and there's no way on Zoom for me to sign up.
The Ebenezer or Paola should give you that.
Yeah, I think you could either raising your hand or doing it through the Q&A. I think that's what we've done in the past. This is our 9th meeting.
Exactly.
We can't comment in the Q&A except to resolve questions.
Yes, you can. We have.
No. I hit the Q&A button. All I get is a list of questions that are open, answered, or discussed.
Yeah, like right now to have Eileen King, who's requesting to speak during the public session. Ted Gallagher is requesting to speak during the public session. So you just write those people down, or we write those names down, and then when it's time for them to speak, we promote them from attendees to panelists. They get to speak, and they get
what I'm saying, Ellie, is I would like to speak during tonight's public session. And I have
no problem. That shouldn't be a problem.
Okay, great, thanks.
All right.
Hi, it's Graham Barr. Also, I was hoping I could share my screen, which is disabled currently.
Yeah, Dr. Barr, sorry for the issues here. We're trying to get that resolved.
No problem. Thank you.
Sorry about that.
Welcome to be select.
Hey everyone, this is Catherine. I'll be taking stacks for the public session. So just if you're interested in speaking, please type your name in the Q&A and I'll add you there. And Sarah, I got you as well. Sally, sorry.
Currently, I can't turn on my video. I don't think anybody can.
That's right, Jim. Apparently no one can turn on their video.
Right, well, they should fix that.
Jim, I believe that's what they're working on.
Excellent. Excellent.
Va bene.
Also, I apologize. I'll have to leave after the COVID session due to my wife's birthday.
Happy birthday.
Thank you.
Happy birthday.
A virtual happy birthday.
Exactly. Delighted to be here, though.
Why are we not allowed to use video?
Yeah, I'm curious. I'm trying to, and it says that I am not allowed
It
to.
says you cannot start your video because.
It's an issue they're trying to fix.
Yeah, it's a
Oh,
technical
okay.
issue that everyone's experiencing.
Okey dokey.
Thank you, thank you. Love you, everybody. Thank you.
Love you too.
Dare I say that I'm happy not to see anybody's faces tonight, especially my own.
Also, you can't even see anyone else, right, Sally? You can just see names.
Now, the only video that we can see is Ebenezer.
Yeah, okay, me too. I was just curious.
I can see my monarch picture, but that's because it's loaded in my system.
Right, right. I can see, like, you know, pictures. I can see Omar and Tanya and Mariella and Chris, although that's not Chris, but I can't see any live people.
You mean any people live? Because all the people should be live.
I don't know. They could be The Walking Dead. You never know. You never know. They could have advanced.
People
They
This
could
is
have
the
advanced.
season for it, right? This is the season for it.
Yeah, well, maybe next week.
Saturday.
Oh, no, I don't want to, no.
I can see a couple of puppies.
Yeah. Oh, my puppy will be back later. She's playing in the living room at the moment.
You should go to settings and change the icon to show video when people enter. We may have to log out and do this over. I'm not sure if it's possible to change the setting in real time.
Yeah, I don't think so either.
I believe you were right, Curtis. Eleazar,
Yes,
we have a request from Adrian Felton from the New York State AG's office. She has to hop off by 7 for another meeting. So if there's any way that she could say, I'm just looking that she's got a comment up here in the chat. If there's any way that she could say a quick word about voting, since it's pretty timely, before she has to hop off at 7.
sure. Shouldn't be a problem. I'll put her, my report is going to be very short, so I'll just have her speak on my report as part of my 10 minutes. Shouldn't be a problem.
Who else here is going to be a poll worker? Anybody else being a poll worker besides me? Oh, silence.
Make sure you go to vote.
Try to turn on your video to see if it's possible. It work?
Nope.
Yep.
Yes, I seen people. I seen people.
Yeah, it
Thank
works.
you, Chanel. Thank you.
Beautiful, thank you.
It works out.
Sally, put
Okay.
the camera back on, Sally.
Let the games begin.
Sally, put the camera back on. You're not going to get away with it.
Why? I'm shy though.
No,
Okay, well, let me finish what
there
I'm
you go. Yes. Put your face back on.
Eleazar,
Yes.
do you want me to answer some people's questions in the chat? I don't want to.
I would love to. Yeah, Catherine, just skip the stacks and then Liz is going to answer some of the questions in the chat.
Okay, go ahead. I answered a few, Liz, so just
Okay.
double check in the answered section.
All right, so I'll take care of answering people's questions, and if you can take care of pulling people's names who are signing up for the public session.
Great. Thank you for volunteering. Appreciate that. I really do. I think we have quorum, right, Liz? Catherine, do we have
I'm
enough?
not the secretary. You'd have to ask Osi.
Sorry, I'm so used to it.
Let me
We
ask
have
you.
Ozzy.
Hold on a
We have
second.
quorum.
I'm checking. I think we do, yeah.
We do?
Hold on. Give me a second.
Sure, no problem.
Do we have the tallies on our budget items, on our priorities?
We'll be discussing that in Ebenezer's report.
Oh, thank you. Ah, Sally.
Yep. Ellie made me.
Richard, your beard is really filling in. I like it. It's a good look.
Favorite shop.
You and
We are, I'm
should
sorry,
have
I
little
think we are
beard
20,
This is
We're-
subliminal.
we are, Eli, we are 24, I see 24 board members, but maybe I missed some that are not panelists yet.
Let me see if there's someone on the attendee that has to be promoted. That maybe it's one of the board members.
I'm not seeing any board members who aren't panelists.
I thought you said you were in the secretary.
Well, she's just,
That
okay,
notwithstanding, we
that's
still
another
don't
option.
have any attendees who
No,
are panelists.
yeah, no one on the attendance list, so 1, 2, 3, 4, 5, 6, 7, 8. Yeah. 10, 11, 12, 13, 14, 15, 16, 17.
29, 30, 31, 32. We have 32 members, OC.
Okay, so maybe some joined after my count.
Okay, good. All right. So,
6:37.
37, good. So, Dr. Barr, I know today is your birthday, so we're gonna get you on point and on time as soon as we can. So we're gonna call the meeting to order. It's 6:38. Welcome each and every one of you, guests, members of the public, community members, board members. First, I'd like to congratulate all of us for having such a prompt, swift, and productive meeting on the last meeting. So, if you will. So I just like to thank ourselves for making it happen so swift. I know the people, all of us who have families and have other jobs, really appreciate and take into account the fact that we have been extremely disciplined in our timekeeping. I'm gonna have a motion to adopt October's 2020 agenda.
Motion.
Seconded.
All those in favor?
Aye.
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 Any objections? October 2020 agenda has been adopted. Moving along to adoption of the September 2020 minutes. Can I have a motion to adopt September's 2020 minutes?
Motion.
Second.
Any objections? All in
I'm
favor?
sorry, who's second?
Gabriela,
Gabriela.
Okay, thank you.
you're welcome.
All in favor?
Aye.
Aye.
I have September's 2020 minutes already on the floor. Gonna have my, you please, Ebenezer, promote Philip from Jumanis Williams' offices to panelist. Thank you. Name is Philip. I hope he has his name on his cell phone. On my report, short, we'll have to congratulate ourselves and congratulate our office on the prize and the award that we've received by SDSNY and Pride Industries. Community Board 12 came in the first place in the third quarter and second place overall for the Manhattan Paper Challenge. We were given an award of $15,000. We are looking for you guys to send your suggestions to Ebenezer's email for any organizations that you guys feel fit the following criteria. Number one, they have to have served in the winning community district. And if not, they have to have been organizations that went above and beyond the start of the pandemic. So those are the two criteria for organizations that you guys have in mind. Not all of us know everyone And I'm sure that there's a lot of other organizations working the ground and being extremely active in making things happen. So I'll appreciate if you guys can start sending us those emails. We have until next Monday to have an entire list of organizations that we will be considering. On my second note, Catherine, I want you to please go over tonight's elections for our first virtual election. If you can just kind of like go over it, and so people can understand what it is that we are doing for the first time. So we're innovators. Catherine.
Hi, everyone. Good evening. So we will be voting for tonight's special election for assistant secretary. It is on the agenda tonight after the public session. So just in case people have questions or were wondering when it would be, you already know. And we're going to be voting through OPA vote. So it is first time, we're again continuing to move virtual. So we had the Survey Monkey, and I hope that the ranking was a pleasant process for folks. And happy for folks to please share some feedback via email. You can send that to both Eliezer and I. And so essentially OPA vote, everyone will receive a personalized link. And really simply, you will see the names of both candidates. And you select on the candidate you want, and it ushers into the back end of OPA vote. And so by the call, after we call roll call this evening, we will send the link. So you would have to go into your email, and then you can vote. After which, Ebenezer and I believe Jonathan, I'm not sure. Yes. Oh, Ebenezer and Jonathan, all the responses go directly into OPA vote. It doesn't necessarily go to any one person's email. It goes into OPA vote, and they will tally and report back by the closure of the meeting.
Just a quick question or observation. I don't see in my email an attachment with tonight's agenda. I've got the minutes and the reso. So if someone from the office could just resend that, I would appreciate it.
If you receive the email with the resolutions and the minutes, the agenda is part of that attachment, but I will forward you agenda by itself.
Okay, thank you.
Yeah, it's probably on the second column, it's the third or fourth item.
Yeah, I will check again, but I didn't see it.
Yeah, it was confusing for me as well. Any
Just
questions
the one
for
thing,
Catherine?
Yeah, if there's any questions, if not, just one thing, based on, the rules that we have in the bylaws, we do have to call roll call at that moment. So I will urge folks to please be patient as they do the roll calls. And then we'll definitely be on standby for folks who might be on only, your cell phone or your laptop and can't toggle in between screens. So I do encourage people, if you do have a laptop, be on your laptop. If you're on a tablet, or if you do get your email to your phone, use your phone to vote and stay on the meeting on the tablet. And that's it.
All right. Ms. Felton, Liz is her name, from the AG's office, so I can get to Ebenezer and then to Dr. Barr, because I promised him he'll be on at 6:45.
Yeah, it's Adrienne Felton.
Adrienne
So if someone can promote her to a presenter.
Yeah, Ebenezer, if you can start your report until we get Ms. Felton in, or Mr.
Ms.
Adrienne, you said?
You're muted.
Thank you, Mr. Chairman. Always is a pleasure to be here as your district manager. I give you my monthly report.
No.
First, I would like to
I
start.
thought Ms. Felton was doing her report and then Ebenezer.
Excuse me.
She's on now?
Yeah, she's on.
Okay, so Ebenezer, she's gonna steal a few minutes from your report, and then we can, so she
sorry.
can move on. She probably has 1,000 other meetings to go to and do the same, right?
Yeah, I have about 3 more. Thank you so much for indulging me. I just want to thank you, Chair, District Manager, and all the board members. My name is Adrienne Felton, and I do represent you at the New York State Attorney General's Office of Tisha James. And I popped on tonight to let you know that the AG's office, we actually have a hotline for voters, voters who are in need of assistance, that hotline is open as long as the polls are open. And even after that, during the daytime hours, if you have any questions, even if it has to do with your ballot, or if you feel suppressed in any way, or you just have general questions, you can call that hotline and an attorney will be there ready to receive your calls. I did actually place the information inside the Q&A. So I hope that, you get an opportunity to share it with the board members and also with the rest of the constituents who actually attend your meeting, and even just to your respective bandwidth, to your listserv, so that everyone knows that that is a resource during the times that we're voting. And also my personal information, I believe I sent it, but I'll send it again, so you guys can get in touch with me. It has my email address. It has even my mobile number, because I am in the Harlem Regional Office, which is from 86th Street on up an entire borough of the Bronx. And I'm still working remotely, but I am reachable. I am your representative, and that's all. Thank you.
I'm sorry, for the purpose of the minutes, can you please tell us the phone number, the hotline phone number to call?
No problem. Hold on, I have to get that here. Yes, the hotline number is 1-800-771-7755. Again, that number is 1-800-771-7755. And also you can actually go to our website, which is ag.ny.gov. And as soon as you get onto our website, you'll see where there's a link there, and it even asks you if you want to be one of the hotline receivers. We have training and all that good stuff. So
Thank you so much.
But if you look inside the Q&A, I also put the actual link that has the resources. So if you can share that, that'd be fantastic.
Okay, I just don't see it from here, from my end.
Sorry, we'll just send you it if you.
Yeah, I placed it in the Q&A section. I think that was the only place I was able to.
Paola, if you can copy it, and so we can keep it and use it for send some sort of email distribution. So,
okay,
thank you, Ms. Felton. Ebenezer?
You're welcome.
Okay, thank you, Mr. Chairman. Like I was saying before, always it's a pleasure being here as your district manager. I give you my monthly report. My report is very brief. First, I just want to announce, or just want to inform that we have a solution, or we, work it out during this past month, a request that we had last month regarding the information we sent out with the licensing committee materials and the supporting material. So during this month, we sat down with the staff and the chairperson, et cetera, and going forward, starting November 2020, we will be sending a more comprehensive licensing committee, including the questionnaires. So next time we're going to have our next licensing committee, you will receive an enhanced package with including the questionnaire. So now I also I want to respond a few minutes ago regarding our budget ranking. I would like to inform you that 15 board members submit the website that we had available, the platform that we had, and we were able to open up today and start doing the preliminary count. We're planning to release this information this week before it's over, because we have to submit our statement of district need and our ranking by Friday the 30th. So as soon as we have the tally, we will send it to every one of you. This is the end of my report. Is there any question?
Hey,
no, thank you very much. God bless you all.
I have my hand up. I don't know if someone was checking the stacks. Ebenezer?
Yes.
I submitted my rankings on Friday afternoon, but I also sent an email to you and other office staff. In the SurveyMonkey format, one of the traffic and transportation items got broken, so that, after a comma, the sentence was supposed to continue. It instead got broken into a separate item. There was no way to give both items the same number. So I noted that, in my email, so I'm just wondering how that's going to get fixed.
Hey Wayne, sorry. Can you send that email to me? Send that email to me to Nobles. I think I'm like Nobles1983 @gmail. It should pop
Sorry,
up.
Nobles. I was just gonna say I fixed it after I saw Wayne's email.
Oh, done.
And yeah, so I fixed that on Friday evening, I think it was that you sent it, or Saturday morning. And there was another thing around the continued funding item that you highlighted.
Continuing support that got put into the survey, and the survey would not let you submit with them blank.
Yes.
So although technically we don't have to rank the continuing support, you had to rank it in order to submit it.
Yeah, so that was removed too.
Okay, guys.
Okay, thank you. Is
moving
there any
along.
other question? I see.
Thank you thank you, Ebenezer. I just want to get to Dr. Graham Barr. Again, I'm sure all of you guys have seen his title, Professor of Medicine and Epidemiology at Columbia University Everett Medical. I shouldn't just say that. Columbia University Everett Medical Center. Carla Alvarez, who is the person that scheduled it. Thank you very much. And Dr. Barr, since today's his birthday, please, the floor is all yours.
Thank you so much for inviting me to speak. It's an honor and a pleasure, and for taking the floor. I don't know if it's possible for me to share my slides. That would help a little bit. It's disabled
Sure.
in Zoom.
Give me a second so we can make you a host, and I think you're able to.
Okay, that would be great. In the meantime, I will get going. So again, it's a pleasure to speak to this group, and I'll try to keep my comments brief. And if there are questions, happy to take them. This is obviously, I wanted to give, touch on kind of where we are in the epidemic, particularly locally. Some of the things we've been trying to do at the medical center to help. Sorry, it's just, and then make a few comments about not prognosticate on the future, but sort of say a few things about where we might be going. Sorry, I'm just trying to get my slides up. I think I'm, actually have, like, sorry, just a sec. As you know, nationally, things have been fairly hairy around. Sorry, I'm just trying to get these slides up, which is not showing. All right, hang on. I think that's just giving my desktop. Is that right?
Now we can see the COVID-19 update.
Okay, that's good enough. Let me see if does that work?
Yep, perfect.
Great, okay, super, all right, thanks. Okay, sorry about that. Okay, so as I was saying, nationally, we obviously had, to say the least, a spring of it, and New York City doesn't really show up here. But if we look at the numbers over the year, of course, we had a massive epidemic locally in the spring. But really, as we look forward, and obviously reading the papers, the situation now in the last 7 days is unfortunately this virus has spread throughout the country. And really, many of the states in the Midwest and further west are in as bad shape, if not worse, than we were in on a per capita basis in the spring. We all know the local geography of this. This shows sort of how the number of cases in April, with particularly parts of Queens, the Bronx, and northern Manhattan hit particularly hard. We are just in a wildly different position now. Not only is the colors are much brighter on this map, but the scale is entirely different. So the scale sort of ended at the worst situation here. So we're in a lot of a log scale different situation in New York now. We're reading about resurgence, we're reading about the rest of the country, but where we are in New York City, we look at the trends since March. This was the huge wave in the spring and April. It's declined. And really since then, we've had, I don't want to say no cases, but next to no cases in July, August, September, and continuing into October. And this is a massive effort. And we have to acknowledge the part of just the general public is frankly doing the right thing. And this is what's keeping this under control. We've sort of have an experiment here in what happens with this virus. And we had in the spring, we had a period of unimpeded transmission where either we didn't really know what was going on or people didn't follow or I would say the political actions weren't taken early. And we had this sort of exponential rise here and spike. Once the shutdown went in and masks were wearing and everybody was staying home, it just worked, right? The drop off here is as rapid as the uptick in the unimpeded transmission phase. And since then, even with reopening restaurants, reopening some bars, obviously at lower capacity, reopening schools in New York City is the only place to have really done that on a large scale in the country. People are wearing their masks, they're social distancing, they're being careful. And look at this, the numbers stay low all through this period. So I want to sort of emphasize some of the positive here. The city has done an incredible job. We really got hit hard. The neighborhood has been doing an incredible job. And everybody on this call has been doing an incredible job. And it has been working. And New York City is in a situation that is unlike the rest of the country right now. We are doing really well. And it's a critical point now to keep it up as the weather gets cold, as sort of people get bored, people want to do new things, and keep going on that. And this virus is very simple. You know, there's a lot of people saying it's too complicated. We don't understand it. We don't know what to do. You know, we know exactly what to do. This is the transmission. It's the coronavirus. It's like a common cold. Coronavirus causes about 1/3 of common colds. This obviously one is worse. And this is how it's transmitted. You sneeze and the droplets go out and it's a little bit airborne, it's a little bit droplet, and you stop it with a mask. And it's really that simple, and keeping away from others, washing your hands. And you know, it's not a political thing. If you think about somebody sneezing, nobody says you're a lefty or a righty to cover your face when you sneeze. Right? Nobody does that without covering their face. And it's the same thing with a mask. This virus is a little worse and we got to take it a little more seriously and we got to cover our faces a little bit better. And this is how we eliminate transmission. And I want to emphasize, the city has done a great job, and it's the population, it's the people in the city who are doing the right thing. And really, you know, 95% of people around here are wearing masks and being careful, and it's working. So I'm going to just say a few words about the opportunity of some of the research that we've been doing that we hope has been impactful, and in particular has been born of this community. So the medical center has been pushing out and has been sort of a world leader in terms of changing the debate in COVID. And this is, as I say, largely driven by working with the community. This is a paper we published in the New England Journal in the spring that was the first study that showed that hydroxychloroquine, which you otherwise shouldn't really have heard of, but probably have heard of, in hospitalized patients with COVID-19 just doesn't work. There was all sorts of, I would say, pseudoscience going on before this paper came out, and this was being used widely and promoted widely. And this paper really shut that down. There were subsequent trials that came out that showed exactly the same thing, that this does not work in COVID-19. And I want to emphasize that this is from 86% of the patients in this study were from community board 12. So at least 50% Hispanic, at least 15% Black, and frankly, a small minority of white patients in the study. And this has a global impact, 1 million+ page views looking at this study. We're trying to keep it up now and figure out, we know we have a lot of people who were in the hospital for a long time. In fact, we had about 3,500 patients hospitalized with COVID through the spring and summer. And we need to find out how those people are doing now. And we're pretty sure that some are absolutely fine and that some are really hurting. And so we have several new NIH-funded studies to look at the long-term consequences of COVID-19 on the lungs and the heart, and using a variety of techniques. And this video just shows sort of some of the imaging we do to look at the lungs. And you can see sort of these are more damaged lungs from not from COVID, but from smoking, and heart function that we can do with CT scanning and MRI. And this is the blood flowing through the heart in somebody with a heart that isn't working that well. We're going to recruit this study from people who are hospitalized at the medical center and controls who live in the Community Board 12 who were not infected with COVID-19, have some of the same risk factors, but are just doing fine. And it provides us information that's directly relevant to how we're going to care for people in this community going forward. On a larger scale, we also have some large national studies that are a collaboration of actually 14 large cohorts, including things like the Framingham Health Study, heart study in Massachusetts, but locally including the NOMAS study, which is the Northern Manhattan Stroke Study, again, Old Community Board 12, the multi-ethnic study of atherosclerosis, and the Hispanic Community Health Study, both of which are recruited in Northern Manhattan and or the Bronx. So we hope with these studies, we really will be able to do community relevant research and better care for people in the community and really provide direct information to people back. So I'll just say a couple more words about where we are, what the future might hold. There's been a lot of discussion in the press, particularly about a second wave, a lot of projections of badness in New York and around the country. For New York, it's really been a tiny wave so far, and we want to keep it that way. And how do we do that? We continue by being sensible, as we've already shown works: masks, social distancing, avoid crowded spaces. Particularly, I got to think about this as it gets cold. And as we look at people out and eating, drinking, and we want the restaurants to do well, but just remember, eating and drinking is actually not protected for COVID. So if you're in a restaurant, it's a good idea to keep your mask on. For nothing else, making sure that the waiters are safe too, before the food comes or before your drinks come. It's not a panacea to be in a restaurant, and we want everything to go. Flu vaccination is key. We already have a vaccine, and it's the flu vaccine, and you really don't want to get COVID and the flu at the same time. It's critical to get the vaccine. We know what we're doing now, and if things get worse, we can reinstate public health measures early. Hopefully we won't want to. Won't have to, and there's a much better capacity for ICU and hospital beds now, and better plans for discharge planning. It was definitely a problem the first time around. So finally, I'll just say a word about the vaccine. Again, a lot in the press about this. This is just to say there are various different ways to stop this virus, potentially with a vaccine. We have at the medical center, there are either now or about to be 4 of the 5 big studies are going on and recruited locally, and we encourage people to participate in these studies. It's incredibly important, but we don't know the answer yet, and that's why the studies are going on. We're hopeful, but we need to get these studies done to prove if a vaccine works or find out if there are any problems that cause it not to work. So in conclusion, I'll just say the pandemic continues to worsen really in much of the world, and unfortunately in much of the US. Its course, though, is predictable, and public health interventions are effective. And that is very, very clear, as we've proven in New York. High impact research is moving forward locally for the local community and for the global community. And New York City remains in good shape. But the coming months are uncertain, and we want to continue our vigilance so that we can keep things under check, as we've done so successfully as a community, as a city, and as a really great group. So thank you for your attention. I'm happy to take any questions, and again, be safe. And I also reiterate on the voting part. Thank you.
I should clap and say happy birthday as well. Thank you very much for taking the time to be here with us. And this is just the first of a series of 3, hopefully more, presentations at Columbia University through Rose Farmer, Sandra Harris, and Carla Alvarez are gracious enough to have doctors like yourself come and speak to the community directly. So Catherine, if you want to check the stacks and take those questions relevant to the presentation so that we can move forward into public speaking, I'll appreciate that.
Sure. So we have Francisco. Francisco, your hand's up. Is it relevant to the presentation we just received? Go ahead.
I just have to unmute myself. How you guys doing? Happy Tuesday. Dr. Barr, thank you again for your time. It's extremely appreciated. As far as Inwood and Washington Heights, what are our numbers look like? I might have missed it. I came in a little late. What are our numbers look like? And is there something that we could do more, especially like the businesses who are getting ready for the winter? What are some of the things they can do to help our community and the citizens?
Yeah, no, thank you for that question. You know, Inwood's looking pretty good right now. You know, everybody's doing a great job. You know, you walk around the street, most people are wearing masks, and the numbers reflect that. As you know, there's been, from the press, there's been some little outbreaks in the city and north of the city, but they've mostly been not around here. They've mostly been in localized communities. And so the Inwood numbers continue to look pretty good. In terms of what to do, you know, I think it's really following what's working right now, which is social distancing, which is wearing masks, not thinking that we're, you know, a lot of people were infected around here in the past. We hope that has some effect, but we don't really know that for sure. So you gotta, you know, assume that you know, one's at risk, and just be careful. And as we think about businesses, you know, trying to keep the density of people in there low. There's nothing dangerous about coming in for the business, somebody coming into the business. And, you know, we want the businesses to be going, of course, it's critical. But just having too many people in the store, if you like, at one time, and trying to keep things, you know, apart enough, and as much as possible, masks on. You know, you see a lot of people waiting for food, for example, at restaurants with no drink and no food. That's a great time to be wearing a mask. And then, you know, obviously when you're eating, that's a different thing.
Oh, last thing, those temperature things that they do when you walk into an establishment, do those things work? Is that something that they should keep doing or modify it anyway?
Yeah, that's a great question. There's a lot of debate on that. And, you know, I mean, the hospital's doing it. There are some recommendations around it. But it's not, and it certainly helps, but in terms of how much does it help, it doesn't help much compared to wearing masks, washing your hands, and the rest of the stuff. You know, the other thing is people, you know, you can see what happens when people test, and then there's a false sense of security when you think they're, oh, you know, like in the White House showed us very clearly, unfortunately, that, you know, if everybody thinks it's all fine, things slip through. So I don't think temperature checks are critical. I think it's more critical that people are, you know, social distancing, wearing masks, being polite, giving distance, and so forth.
Thank you, Francisco. Catherine, anyone else? Dr. Barr, I'd like to also say that you're now a phenomenon. You're trending on our Q&A. You're getting so many thank yous and so many nice comments. Maybe you should come more often since we have 100 and some participants.
So welcome. Thank you.
So we have 3 more hands. So I'm just gonna call them as I saw them: Steve, Barbara, Ashley.
That should be it. That should be all.
Yeah, doctor.
I had my hand up too.
Yeah, you were 4.
Can you hear me?
Yeah.
Yeah, hi, doctor. I'm the chair of the Health and Environment Committee, and in fact, I was going to give some statistics about Washington Heights and Inwood as part of my report, but it seems more relevant right now. I mean, you're correct that Inwood is doing relatively well. Since the beginning of the pandemic, there have been 962 cases, and it's remained steady. 167 deaths. There haven't been any increased deaths, but overall in our district, we've had just under 6,000 cases, and there's been an increase just since the last meeting we had as a board a month ago of 354 more cases. So that seems somewhat concerning. We've had 4 additional deaths in the last month, 2 in zip code 40, 2 more in zip code 33. Certainly not as bad as it was back in March, April, May, June. You know, we've had a total during the pandemic of 930 deaths, but so I guess having only 4 over the course of the last month isn't all that horrible, but it is pretty bad for the 4 families who are suffering from those deaths. But how do you how would you evaluate the fact that we have 354 more cases in this last month? How serious do you think we should take that?
Yeah, it's no, that's a great question, and I am not suggesting at all that we do not have to, you know, that we should relax or think everything's fine, or you know, we really need to stay on this, and there is a fatigue, right? Because you know, we've been wearing masks for quite a while now, and the summer's gone, and so forth. The numbers are not zero, as you point out, and there is transmission in the community, and there is more transmission in the community than there was in July and August. I'm sort of speaking about generally in the city and including in Inwood. But the numbers are for the population size are still remarkably, and I think are reassuring. We are seeing nothing like we saw in the spring. We are seeing nothing like is occurring on a per capita basis in the Midwest, in Texas, Louisiana, the Dakotas, and so on and so forth, where they're really, really struggling. So it's not.
There are 77 zip codes in New York City that are worse off than we are. They're worse off than zip code 40, and you know, and our other 3 zip codes are even further down on the line. So clearly we're not the worst of New York City, but still seems as though we have a serious situation to contend with.
Absolutely, and that's why we have to continue to, and you know, and particularly as the weather changes and people are going to be indoors more, we have to continue to take these public health measures very, very seriously, because it's not that I was not at all suggesting the transmission in the community is zero.
Has the medical center kept its capacity where it's been before, or has it is it prepared for another wave if we get it?
Yeah, and you know, again, the numbers in the hospital are not zero, but are tiny compared to where we were in the spring, and we don't want to be back where we were in the spring.
I would love to have those numbers.
Yeah.
Could you provide us with those numbers for the hospital?
Thank you.
I don't want to give specific numbers, but it's sort of numbers that are, if we're talking about Columbia, you know, the medical center here in this neighborhood, we're talking about counting on 1 or 2 hands.
I think Dr. Barr through CUMCC office is open enough to maybe sometime next month come into your committee and kind of like have the presentation so that you can have more in-depth questions. Since I have a few more people lined up that want to ask questions as well. Catherine, who the next person?
We had Ashley next.
Thank you.
Cool. Thank you, Dr. Barr. I had a couple questions in regards to the COVID-19 research study. So my first question, because I recognize that because it's at this medical center, it makes sense that 86% of the patients would come from this community, and a large amount of those patients would be Hispanic people and non-Hispanic Black people. That makes sense to me. My first question is, have you seen other large hospitals do this, like NYU Langone in the Kips Bay area or Murray Hill, or was there ever any thought to do this at Columbia University's other medical centers? I recognize you might not have like the main answer, but maybe you know. And then my second question is, given that hydroxychloroquine, or sorry if I've mispronounced it, I'm definitely not in this field, but we've seen effects from it and heard commentary on it. Have we followed up, or is there follow-up at all from these patients, or information that we can review as constituents of the community or members of the community board?
Yeah, I think, well, first of all, for your first question, there are, so some of these studies, for example, the one I showed was published very early, and so we were just using data from the medical center here. Subsequently, there are many more collaborative studies, including more parts of the NYP system, collaboration with Northwell and other hospital systems in the New York area, and more general collaborations around the country and the world. So the sort of first phase was very local, and then we're expanding out. Most people think hydroxychloroquine was fairly benign. There was always a concern about some arrhythmias, which are short-term heart irregularity, which hasn't really borne out. That was something people were worried about, and it's a known side effect. But there's subsequent studies that show there wasn't really much going on in COVID. So most people think that it was neither helpful nor harmful at the end of the day, but not worth the amount of press time and so forth that it gathered. But yes, I think we are very interested in, and now we're trying to do a number of studies to see how people are doing, months after the hospitalization, because clearly, some people are absolutely fine and some people are really not. And we need to understand that better. Frankly, the world needs to understand that better.
Okay, thanks. Catherine, next.
Barbara.
You have two more, doctor. Don't worry about it. We're gonna let you go.
It's okay. Happy to speak.
Barbara.
Barbara, unmute yourself.
Yes, unmute yourself.
Thanks.
I wanted to ask, in terms of what more we can do, how much evidence is emerging on how difficult it is to transmit COVID? I had read a few articles, I admit in more popular press, that said that it seems to take at least 15 to 30 minutes of close contact for it to transmit. Is that the case? What do you think? I'm concerned about that because in Washington Heights, Inwood, we have many people who live in crowded conditions, and we have kids going back to school who could be transmitters, bringing it home to vulnerable populations in their apartments.
Yeah, I mean, that's definitely a concern. There is, particularly kids, there's a lot of discussion back and forth in the scientific community about how much kids really, particularly young kids, really transmit. One of the good news parts about this, if there is one, about this epidemic, is that young children are really not affected, which is not true, for example, with flu. But there is some concern about transmission, although probably they transmit less than adults. To answer your first question, I don't think we have a clear answer on that yet. If you walk past somebody in the street, it would probably be fair to say it's almost impossible to catch it from them unless they really make an effort to sneeze directly into your face or something. So it does need, more than a casual contact. Probably, something like half an hour. It depends a lot on the conditions. depends a lot. If people are singing and shouting, there's pretty good data that transmits more than people sitting quietly in class, for example. Or heavily exercising, like gyms. That's a bit more of an issue than talking quietly at the table. And it clearly depends where people are in the infection, when somebody's infected. And some people transmit a lot, some people transmit less.
Thank you. Sally is the next, right?
Yeah, I guess just two things. One is I'm also a little concerned about hearing too rosy a picture, I guess, because not only with COVID fatigue, but people looking for reasons to not treat this pandemic as seriously as it is. I wonder if we have enough experience with kids going back to school, given the incubation period, bars or inside restaurants reopening, health clubs, etc. I mean, I've basically been warned by epidemiologists, don't eat inside, don't go to a gym, stay outside. If you need to have social contact, make sure it's outside. And so I just wish you could address that. And also, given that the number of cases that New York Presbyterian is seeing can be counted on two hands, is it not time to reopen the psych units at Allen and Brooklyn Methodist?
Sorry,
That's my second question.
You broke up. So the transmission, again, if you're at the other end of the spectrum for all of that, the risk is very low. So, I mean, again, if one is singing a lot or breathing a lot, I mean, literally, choirs, gyms, situations where there's loud arguments or loud talking going on, that's all associated with higher transmission. Is it a great, at the other extreme, outdoors, the great thing about it outdoors is ventilation, right? So, you're dispersing, even if somebody's infected, they're dispersing into infinite space. So it disperses very, very quickly. So that's why one is, from an epidemiology point of view, we're much less concerned about people eating outside. That's a whole different story from having a packed restaurant or far less a packed gym or a packed choir rehearsal. So it's sort of a spectrum, but clearly, it's not that you can't get infected wearing a mask or you can't infect somebody, but the chance of it just drops dramatically. Right. And if we, what's happening right now in New York is there's few enough cases, not that nobody's getting infected, not that, unfortunately, the number of deaths is zero, but rather there's just not enough transmission for it really to take off. And most people are doing the right thing, and that slows the transmission. So we're not seeing what we saw in the spring, which was this. We're seeing sort of this, and it's serious. And I'm not trying to say it's a great situation, and it's much worse than not having COVID, obviously, but it's ticking along and it's being controlled by people doing the right thing. And we need to continue to do that. And that's what I'm trying to get across.
Okay, thanks. I think that'll be the last question.
Wait, we didn't get an answer about the psych beds at the Allen Pavilion. There were two parts to Sally's question, and Dr. Barr did not answer that second part of the question.
Sorry, what was the specific question about the psych?
The question was, given that you can count the number of cases on one or two hands, is it not time to reopen the psych beds at Allen Pavilion, given that we're going without inpatient psychiatric services, and also at Brooklyn Methodist?
Yeah, that I actually do not know the details on and can't answer. I'm sorry, that's more, these days there's Columbia University Medical Center and New York Presbyterian Hospital, and that's an NYP decision, and I don't know the details there.
Anything you could do to influence it would be appreciated.
Okay, Catherine?
Quick question.
Neymar, and then we're gonna go into public session.
Yeah, Francisco, so you had already spoken on this based on
Yes.
Robert's Rules of Order. So yeah, Naima's last, so go ahead.
Thank you. Sally, thank you for that question, because actually my question is related to the one that you just made right now. Hi, Dr. Barr. So my question is regarding mental health facilities, for example, the New York State Psychiatric Institute. those facilities do not accept visitors at the moment due to COVID-19. I actually went to visit it today and was told that this the rule to end visitations was established in March when the pandemic, earlier in March, and it has not been changed, and we are already in October. And when you visit city hospitals that are supporting people with mental health situations, they are allowed one visitor at a time. Yet in this state-run facility, no visitors are allowed. And I checked, Governor Cuomo sent out a memo through the Department of Health, which says that only sites or facilities in red zones and orange zones have to follow certain more stringent protocol. And the zip code 132 does not fall under any of those zones. So as a follow-up to Sally's question, what can we do to advocate for the Allen Pavilion to be opened up, for those psych beds to be opened up, number one? And number two, would you say that it is safe for an institution like the New York State Psychiatric Institute to at least allow one visitor at a time, maintaining social distance, mask, and everything? Because I think that it's very very unnerving. I'm almost done. It's just very unnerving for family members that have families in the mental health system and that they're unable to visit their families.
Yeah. So I can fully empathize and appreciate your point. And this was, I'm in, unfortunately, I'm in medicine, not in psychiatry. So I don't know the situation there and the reasons. I understand, there was the same policy on the medicine floors and for much of the spring that none of us were happy with, but what needed to be done to just keep everything safe at the time. And I just don't know the details in terms of the Psych Institute. So sorry, I can't really comment on that.
Okay. And just last but not least, there's a community resident raising in the chat if you would recommend homemade masks or industrial ones. I don't know if that's a speed question for you.
Sorry, homemade masks or industrial ones? Well, I think for most purposes, homemade masks are absolutely fine. I usually wear just surgical masks, but you don't really need what are called N95 masks, which are the more, sometimes called industrial masks. We wear those when we're going into a patient who we know has COVID and is spewing the virus all around the room. But that's a little extreme for walking around the rest of the hospital or walking around town or going on the subway. And I just wear a regular. These are the surgical masks. They're just paper masks, and it's similar to a cloth one. So that's fine for sort of everyday use. The one thing to add on, some of the industrial masks have a filter on it, and that defeats the point. It's for not breathing in dust, but it means that you breathe out whatever goes straight out in unfiltered, in a sort of a valve way, sorry. So you don't want a mask with a valve on, that's not so good.
Dr. Barr,
May I ask you a quick question? Just one last question.
Francisco, you're going to have to make me break the rules.
It's about vitamins. What should we be taking? Should we be taking them? Does it help? Done.
Oh, you don't want to ask me about vitamins.
He's an epidemiologist.
I'm a naysayer.
Okay.
If you're eating a good diet, you don't need vitamins. But I'll leave it at that.
On behalf of all of us, of 106 participants, and especially the board members, we wish you a happy birthday, everyone that wants to join in. And thank you again for taking the time off.
Thank you so much. It's my pleasure.
And great.
Thank you to everybody.
Could we get the presentation? Do we have the presentation?
Yes, Carla is going to send it to the office, and then we'll have it.
Yeah, thank you. And on behalf of Columbia University Irving Medical Center, thank you for allowing us to join tonight. And thank you, Dr. Barr, for your time.
Thank you again.
Thank you. So we have 17 signees to speak on our favorite part of our meeting, which is the public session. So Catherine, if you can get us to get going here with the names. We're going to be strict very strict with the 2 minutes. So, because there's, at least that I know of, is 17 signees. The people that want
Yes.
to have a shot at speaking.
All right,
Go
so
on.
I feel like I'm on a game show. So this is how it works. There are 17 names, 2 minutes each. I will call your name and unmute you. We'll give you a couple seconds. If you're having tech issues, I'll move on to the next person and get back to you in right after that person. If I couldn't get to you, you had tech issues, something happened, you maybe went to the bathroom and you're back, just raise your hand and we'll get to you at the bottom of the list. I'm gonna share my screen with a quick timer. So first up is Ted Gallagher. Ted, where are you? There you are. All right, Ted, you can unmute yourself.
Okay, hi, can you hear me?
Yes.
Hi, my name is Ted Gallagher. I've lived for 40 years on Henshaw Street in Inwood, and I'm calling about the Cloisters Grill license for liquor service. Henshaw Street, as you all know, is a very, very small, very narrow street. We don't have enough capacity to support a full license for liquor based on our experience with liquor licensees on Dyckman Street. We believe that Cloisters Grill is within the 500-foot rule that precludes the granting of a license for a fourth licensee. Henshaw Street is like trying to thread a needle. It's very difficult with double parking, with emergency service vehicles trying to go through. Members of CB12 have stated that there should be a moratorium on new liquor licenses in this area because of oversaturation. We could not agree more with this sentiment. The noise from the customers, from the music, the traffic, the fighting, the public urination, it's just too much for this small street. And we have 2 buildings, all residential, overlooking this site, and it's just very, very difficult. We'd ask you to consider denying this application for cause and for fairness to the community and the quality of life in Inwood. Thank you very much.
All right, thank you,
Sorry,
Ted,
what-
for keeping it under time.
Catherine, what site was he talking about?
He was talking about Cloisters Grill at 7 Henshaw between Dyckman and Riverside Drive.
Thank you. There was an echo. I'm not sure what was going on.
All right, next
It's
up.
item number 7.
Sorry, so next up is Tara. Tara, you can unmute yourself.
Hi, can you
Time
hear me?
starts. Yes.
Okay, great. Good evening. Thank you for your time. I'm seconding many of the comments expressed by Ted Gallagher just now regarding the Cloisters Grill liquor license at 7 Henshaw Street. I'm a first-time speaker, so I'll introduce myself briefly. I'm a Yale Law School graduate. I'm a partner at a well-known New York law firm, and I reside at 1795 Riverside Drive. My fiance and my future stepdaughter, who's 7, live in the building as well. I agree with many of the prior points he raised and would add that many of these issues are made more concerning by the fact that many young children live on the block just around the corner from 7 Henshaw on Riverside Drive. These children often walk along with their families between their homes and the many parks in the neighborhood and between their homes and the schools in the area. I fear that many of these considerations will endanger the safety of our children and our families. I agree that the fire department uses Henshaw routinely to answer calls on West Dyckman Street because they're blocked from using Dyckman in the block immediately west of Broadway. And noise and large crowds are a nearly daily occurrence outside of Seawalk, Pate Palo, and Mamawata, which are only 1 block away from 7 Henshaw Street on Dyckman, which appears to be in large part as a result of the liquor licenses at these establishments. And these establishments may very well be within 15 feet of the Cloisters Grill. The establishments create a large amount of vehicle traffic as well, which creates further noise and congestion. And since Henshaw Street only allows 1 car to pass at a time and serves as an exit ramp on the West Side Highway, Henshaw Street's not equipped to handle additional traffic together with additional foot traffic that would be created by granting the liquor license on Henshaw. Additionally, the sidewalks are particularly narrow, and it's already difficult to navigate the sidewalks with just a few pedestrians loitering outside of the grill. And I fear that this will be a danger to families trying to cross the street and to avoid and to practice social distancing. Public urination is also an issue. Thank you.
Thank you. So next up, we have Sally Fisher. Sally?
Sally, the board member.
Can you come back to me at the end?
Okay, sure.
Right.
Let me just find, the next person's David Friend. All right, David, you can unmute yourself.
Hi, can you hear me?
Yes.
Great.
Yeah, we got you.
Thank you. Hi, yeah, I'm speaking about item number 8 on the agenda, Buddha at the corner of 193rd and St. Nick's. I'm a resident of Inwood Tower, which is catty corner to this location. And I'm speaking in opposition to their application for a full liquor license. There are a lot of reasons why this application should be denied. This intersection is one that has an incredible amount of problems already. Everything from drag racing to motorcycles to noise to all sorts of things. And people on this block are already really suffering. In my building, over 100 people just in my building have signed a petition that was only put together in the last several days to oppose this license because the quality of life is already extreme on this block, extreme. But to my mind, I really don't even understand how this is being brought to the full community board today, because there is a church directly across the street from this venue. The state liquor, the SLA does not allow new licenses within 200 feet of a church. That is not negotiable. It's not a suggestion. It is mandatory. So there is no way that CB12 should support this application that is clearly in violation of the 200-foot rule. There is a church directly across the street, and there's just no getting around that. So a restaurant is one thing, a nightclub with open glass doors that will open directly onto the street and will have a capacity of 140 people that's very close to a school on an intersection that already has problems and that is less than 200 feet from a church. It just cannot be approved. Thank you.
All right. Thank you, David. And just for the record, can you repeat the business name?
Sure, it's Buddha. It's doing business as Buddha Corp. It's number 8 on the agenda.
All right, thank you very much. So next up, we have Cheryl Miller. All right, Cheryl, you can unmute yourself.
Hi, can everybody hear me?
Yes.
Okay, hi, good evening. Okay, so I wanted to speak tonight on the rankings, and I know that the community board as a whole is going to be voting on the rankings. So I just wanted to ask that the community board seriously consider the speed cameras that was on the rankings for the public safety committee. And I'm on 165 in Broadway, and there's all these dirt bikes that are constantly zipping up and down Broadway over here. And it's really imperative to have speed cameras here. There's been a lot of accidents on this corner over here, car accidents, and with the dirt bikes compelling all of that and running red lights, and cars drag racing has been the norm here. It is really, I really urge the community board to really vote for the speed cameras. I think it needs to be at the top, along with, it needs to be at the top of the list as far as the rankings. So I thank you for your time, and that's all I wanted to say. Thank you very much.
Thank you, Cheryl.
Sure.
Next up is Maggie Clark. All right, Maggie, you can unmute yourself.
Okay, can you hear me?
Yes.
Thank you for the community board to allow us to speak on this issue. Speaking in opposition to 7 Henshaw Street, which is in the basement of my building, 1795 Riverside Drive, where I've lived for over 40 years. I have seen how the liquor licenses have saturated the local area, Inwood, specifically around Dyckman Street. I repeat what was said before by Ted and by Tara, that even the community board itself has said that there should be a moratorium in our area. And we believe that Seawalk, Patapalo, and Mama Juana are within 500-foot radius of this location, and therefore is contravening the 500-foot rule. In addition, the Latter-day Saints Church is a block away. And I have seen on numerous occasions where the FDNY has been using Henshaw routinely to answer calls on West Dyckman Street because they are blocked from using Dyckman Street because of the restaurants in the street just west of Broadway. And I have also heard on numerous occasions noise in the street outside of this location until late hours. I can hear it because my window is right above it. And I urge you to, and the thing is that once you approve a liquor license, and if any of these things happen, there's nothing we can do. And that is very concerning to us. So I hope that you can.
Thank you, Maggie. I'm sorry, that's all the time we have.
Okay.
All right, next up we have Anthony Semino. And if I butchered your last name, I'm sorry. You can unmute, Anthony.
Hello. I'm agreeing with the previous speaker about the Cloisters Grill. I've lived in 1795 Riverside Drive for the last 5 years. My apartment overlooks Henshaw Street. I've worked from home for the last 5 years, and Henshaw Street is essentially a parking lot. Every day there's a backup and a competition of who has the loudest car horn, as cars double park in front of the Cloisters Grill and other businesses. There are at least 2 daycares in my building, and they use the basement exit to bring toddlers out of the building right next to the Cloisters Grill that want a liquor license. There's already enough liquor licenses in our neighborhood as it is. People have already mentioned that the fact that the Mormon church is 1 block away. There's 3 other restaurants with liquor licenses nearby. So I urge you to not grant this liquor license. Thank you.
All right, thank you, Anthony, for keeping it under time.
I do.
So next up is Annette. All right, Annette, you can unmute. Annette?
She said in the chat that she was having some tech issues, so maybe circle back to her.
Yes.
I suggested that she throw her question in the
Catherine, if you can.
Next.
Yeah, just give the names of the next 2-3 people.
Okay.
Or
sure.
so that they get promoted, and that way you don't waste a technical.
Oh no, they don't have to promote to be promoted.
All right.
So it's Kate followed by Gerald. Some people have their numbers, so just for folks know, we're up to number 8. So Kate followed by Gerald. Go ahead and unmute Kate. There's 2 Kates. Let's see. Kate?
Yes.
Hello? Yes, go ahead.
Yes. Hi, my name is Kate Yee. I'm a resident of 1795 Riverside Drive, and I'm joining the call to speak in regard to the liquor license vote for the Cloisters Grill, which is located on 7 Henshaw. I would like to echo the concerns that have been shared by a number of my neighbors in this building. The concerns around noise, around traffic, around safety. Those are all very real concerns. We moved to this building 2 years ago, and we love it. We love living here. We have an 18-month-old son. We walk past the Cloisters Grill almost every day when we take him to the park. It's a very steep walkway. It's a very narrow street. There's a ton of traffic on the street as it is. And it is quite frankly frightening to us, the idea of that street now being inundated with the same amount of traffic that patrons to all of the rest of Dykeman receive with regard to the liquor license that they have into the evenings. At 7 p.m. on a night earlier this year, we heard significant noise. We couldn't even hear our television coming from right downstairs for over half an hour. And that idea of that being prolonged, that amount of noise, traffic, we feel that we'd be forced to leave this apartment and a neighborhood that we love. So that's something that we don't want to see happen. We would strongly urge the board to consider these requests, and also to keep in mind that we have nothing against this business. We do not want this business to fail, but we do want to be respectful to the neighborhood and keep in mind that this is a very small street. It is in close proximity to a church and to parks. It's not wide enough to accommodate the kinds of traffic and foot traffic that a full liquor license would demand. We urge you to vote no on this request for a liquor license. Thank you.
All right. Thank you, Kate. Gerald, you can go ahead.
All right. Can you hear me?
Yes.
Okay. Thank you very much. My name is Gerald Rabel. I want to thank you that I have the opportunity to talk here and address my concerns about the liquor license application of 193rd Street and St. Nicholas Avenue. I think it's called Buddha Bar or Buddha Incorporation or something like this. I think one has to be aware that we already live in one of the noisiest areas of the whole city. We are flooded by noise, specifically during the weekends. The people don't come by subway, the people come by cars. They're gonna roam around with the cars, they rev up the motors, they're gonna windows down, and they're gonna play as loud, the music as loud as possible. They roam around Broadway, Dykeman, Fort George Hill, Fairview Avenue, St. Nicholas. This is a residential area. If you don't believe me, I invite you simply to come during weekend or even during the week. In the evening, it's unbelievable, that kind of noise and this kind of rude behavior. I would say enough is enough. It's really against the health. You can sleep sometimes, and the people just roaming around, and it's, as I said, they don't come by subway, they come by cars. And this is one part. It's really unbearable. And the other stuff is that the application, I think, as one of the former speakers said, it's clearly in violation of the 200 feet rule, because there's a church at the corner. And that shouldn't happen. This application should never have brought forward like this. Okay, thank you very much.
All right, thank you. Next up is Karen Erasmus, followed by, just so they can get ready, where are you? Jesse. So Jesse Henshaw's right after Karen. Karen, you can go ahead.
Right, hi there. It's Michelle and Karen. We're at 1795 Riverside Drive. Been here for over 20 years and have seen the neighborhood completely disintegrate into party central. And hearing that the Cloisters Grill is now going to be added as another place for folks to hang out, I think is unacceptable. So I'm putting my hat in the ring to just urge you guys to vote no on this liquor license. As everyone else has mentioned before, it's an extremely narrow street. You've got folks drag racing, cars hanging out, music blasting. It's incredibly uncomfortable on the weekends and at nights to try and get some sleep. And that small little road, to have extra folks hanging out after hours drinking and partying, I think is just something that the neighborhood doesn't need. We have a new dog, and the poor thing has a hard time sleeping, has anxiety just from the additional noise on Riverside Drive. So basically, just once again urging everyone who's responsible for putting this forward to vote no if you can. We don't need it. We have enough problems here in the neighborhood with noise, traffic, and safety. So please think careful about putting this forward. Thank you.
All right, thank you, Karen. Next up is Jesse. Jesse? You're unmuted, but we can't hear you. All right, I'm gonna move forward to the next person. And that is Dana, followed by Eileen. All right. Dana?
Hi, can you hear me?
Yes, go
Hi,
ahead.
and I think, and Jesse and I were actually probably had the same question, but I can make this quick. I am a girl from Washington Heights. I was born and raised in and around the 187th Street area. And this is really the first time in my life that several stores are closed for a lengthy period of time on West 187th Street. And the charm of this neighborhood is the mom and pop environment. We actually protested to keep Walgreens from coming and taking over one of the supermarkets, or the only real supermarket, or one of two supermarkets in this little area. And there are now 5 stores that are closed. Again, I've been here my whole life. I've never seen anything closed for longer than really a few days to either turn over or redecorate a shop before opening. And I'm wondering, I believe in 2009, there were tax laws passed that gave landlords an incentive to keep commercial properties closed and receive tax breaks rather than rent them and work with potential new tenants. And I'm just wondering if anybody knows what that is and why this would be happening. And it has nothing to do with COVID. This was long before COVID. And I'm concerned about what I believe are these tax breaks for unrented commercial properties.
Okay, thank you. And Dana, I know that this in the chat directed you towards our small business committee, which you can join the meeting coming up. So I'm going to give the next 2 names. Next up is Eileen, followed by Thomas Leverton. So Eileen, if you can, there you go.
Yes, hello. My name is Eileen King, and I am in support with Gerard and David already spoken in opposition to the request item number 8 for Buddha to set up a very large restaurant, 140 customers with live music, a DJ till 2 a.m. You are introducing into a densely residential area, a major nightclub. And we who live in this neighborhood have already endured an impossible summer with all the street activity, street noise that has already been spoken about. I remind you of all the problems with the nightclubs on 10th Avenue between Dyckman and 207th Street. By approving this liquor license, you are introducing into our residential area a large nightclub that is allowed to be open until 2 a.m. I also want to draw your attention to the fact that this Buddha did not post 10 days for at least minimum of 10 days before their application for the public meeting. They had it up 2 or 3 days before. That's all. It shouldn't even be on the agenda now. So I am also asking you to consider these retractable doors. It means that the whole street of their front, which is very large, would be open. The speakers are inside, but the noise will be outside, and we will hear all of that in the neighborhood. So we are asking you as a community board who are committed to quality of life to reject this application because of its serious impact on our already suffering neighbors. And I want to thank you very much. And I want to thank Ebenezer for circulating our petition, which has a lot more information than the 3 of us have spoken about. Thank you.
All right, thank you. Thomas, you can go ahead and unmute yourself. Thomas Leverton. Going once, going twice. All right, we're gonna move forward to Migdalia. All right, Migdalia, you can.
Okay. I got you. I got it. Yeah. Well, I'm a resident of 1795, and I've been here for 30 some odd years. And I'm in awe how Henshaw has turned into I can't even describe what it turned into. And for someone to say that they're putting signs up to mitigate the noise that are coming out there, we have to be respectful. If you want to run a business in my community that I've lived for 33 years, then you should respect the people that live here. I'm a Latina. that lives in this community, which I love. And Henshaw has become the worst street. I don't even go down that street. Because if Seven or whatever, Seven Grill, Cloister Grill, you have to mandate your patrons not to double park. Signs are not going to help us because we don't read signs. We do what we want to do when we want to do it. And that's unacceptable. Be good to your neighbors and your neighbors will be good to you. But you can't come in there, want a liquor license when you know that you double park and you let your patrons double park, eat food on top of cars. When you finish the food, you drop it on the floor and you keep it moving. And this is what you want to do in our community? Come on. Now, be serious. Be good to your, remember this, be good to your neighbors and your neighbors will be good to you. But don't come, if you're not living in this community, to wreak havoc on our peace and wellness. We had enough stuff out here to last us a lifetime. So if you're going to be good to your neighbors. And I hope that you don't give them a liquor license because we don't need this. We don't. If you see the traffic that comes out of that highway.
Thank you, Migdalia. I'm so sorry.
Okay.
That's all the time we have.
Thank you. Thank you.
All right, you're welcome.
Okay,
all right.
bye-bye.
Next up, so Thomas, you found your, let me ask to unmute. Thomas, are you with us again?
He's going to the next one.
Thomas?
No, he's here.
His mic's unmuted. Going once. Thomas? All right, I'm gonna go on to Algis.
Hi everyone, pleasure to be with you all. I want to talk about two things. I want to echo everyone's concerns about 7 Henshaw Street, that is the Cloister Grill, particularly in regards to traffic and noise. I also want to stress that these are existing issues and some of them do have practical solutions that for some reason are not addressed. With parking, people double park like crazy there. I don't know why the precinct turns a blind eye to it, particularly given that New York City is in dire need of revenue. You've got a great source of revenue right there. Just get parking inspectors and issue out tickets. Also want to also echo what was mentioned previously, that the current patrons leave their trash out on the street, and that should be avoided. The second thing that I'd like to raise is intersection safety on the corner of Henshaw and Riverside Drive. Approximately every 2 months, a sign gets knocked down due to cars making a left-hand turn into Henshaw Street from Riverside Drive coming off the Henry Hudson Parkway. There's a visibility issue. There are a number of near misses with pedestrians who cross Henshaw Street. It's a serious safety issue. I want to raise that with the board. I'd like to see something done in the way of traffic calming in that area, and something to improve safety and visibility, and perhaps some bollards on the median strip there. That's pretty much all I have to say. Thank you.
All right, thank you. So third time's a charm. Thomas, are you ready? Thomas, you just got to find that mute button again.
Can you try unmuting Tara? I believe Tara and Thomas are together in the same place. That's what.
Tara?
Yes, can you hear me?
Yes, there we go.
Thank you so much for bearing with my tech issue. I'm Thomas Leverton. I'm a resident at 1795 Riverside Drive. I just wanted to reiterate what everyone has already spoken to in opposition to 7 Henshaw Street, but also to Buddha. The area is honestly is just too clustered. I measured the distance from the LDS church to 7 Henshaw, and it is indeed within 200 feet. So just on that basis, it shouldn't be allowed a liquor license to there. It also, I did not measure, but just doing the easy math, it's easily within 500 feet of the other liquor licensed businesses, which is also against New York statute. So it should not be allowed on that account. I've witnessed ambulances and fire department trucks have to use Henshaw Street as access to get onto Seaman and all the way down to the park and to Isham and everything there, and further crowding that street is just not in the community's best interest for safety. There has already been issues with fighting and public urination from the other liquor licenses that have affected our street. Unfortunately, just 2 days ago, I saw someone peeing out next to the Mormon church, unfortunately, around 9 p.m. This problem, I'm sure, would only be exacerbated. There are 2 daycares within our building at 1795. I know the statute for 200 feet is within schools and churches, but I'm not sure certain if daycares apply. If so, the daycares share the same building as 7 Henshaw, so it should not apply there. I see my time's running out. Again, I just want to reiterate what everyone has already said. I'm in opposition to 7 Henshaw Street and Buddha, and thank you very much.
Thank you. So I just unmuted you, Sharon Pope Marshall.
Yes, thank you. Can you hear me?
Yeah.
Thank you, Ms. Ritter, and good evening, Chairperson, and also community board members. My name is Sharon Pope Marshall, and I am with Bike New York. I'm very excited and pleased to tell you that we have officially christened our Bike Education Center, which is located inside of Riverside Park at 158th Street. Really want to give a awesome shout out to the president of the Riverside Park Conservancy, Dan Gorodnik, and also appreciate the support from State Senator Robert Jackson, as well as Assembly Member Inez Dickens, and of course, last but not least, Council Member Marc Levine. Thank you, thank you, thank you. So what does that mean for you, for everyone who's listening? Please go to our website. We have free bike education classes, from learning how to ride a bike. We will provide loaner bikes for you to learn on during our classes, as well as helmets. And of course, we'll provide the instruction as well. So those classes are on our website. All you have to do is sign up. Thank you very much for this opportunity to talk with you. I really appreciate it. Thank you again, Ms. Ritter.
All right, thank you, Sharon. So our last 3 speakers are Sally, Nobles, and Bernard. So Sally, go ahead and unmute yourself.
I'm unmuted. So I'm speaking with my parks hat on for Friends of Inwood Hill Park. A couple things that happened the last month. We wanted to thank the over 50 families and groups that showed up on the 17th to do the annual Riverkeeper sweep. We took out about 36 bags of litter, 15 of which were recycled. That's about 1,000 pounds of garbage that had been littered or washed ashore along the Hudson River. Across all the sweep sites, we took out 27,801 pounds, which is about 13.9 tons. So it's a great day all across New York. Second, to thank the people who came out, especially Robert Jackson, who coordinated it, the Uptown Dreamers, the Regiven Project, and Hike the Heights. We did a cleanup last weekend in Highbridge Park. We took out 7 black bags, which, as you know, heads right to landfill. And more importantly, 11 recyclable bags filled with recyclable containers. As many of you know, parks does not recycle. If it's left in the park, it goes to landfill. So we try to counter this by getting it out of the park, which we did again successfully. Not only did we clean up litter and recycle, but we planted milkweed in 15 locations, which is important for the migration of the monarch butterfly. Monthly events coming up. we will be kicking off our Beautify Broadway Street Tree Stewardship Initiative. That's essentially to provide the knowledge as well as the tools to people who want to take care of their street trees. We're also doing a monthly cleanup every month. Just check our Facebook page, or if you want to get on our email list, the address is Friends of Inwood Hill at gmail.com. We're also on Facebook and you can sign up there. And finally, we will be doing a planting event on the 15th. You can look at our Facebook page, or if you get our newsletter, you'll have all that information. And with that, I am out of time.
Hey, Sally, right on time. All right, go ahead, Nobles.
Nice, Sally. Hey, folks, I don't usually, speak to, licensing pieces on our agenda.
No.
It's not possible? I was wondering if it's a conflict.
No, it's not that it's a conflict. It's just this isn't the place where individuals speak to that. You can talk about that when we get to that in committee reports.
All right, I'll wait till then. Thanks, Liz.
Okay, and so the last speaker is a member from the public, Bernard. You can unmute yourself.
Okay. I'm just here to remind everybody about West 161st Street between Broadway and Fort Washington, which was literally hell on earth this summer. It's calmed down now, but we still have motor scooters riding on sidewalks in the wrong direction coming up to the bodega across the street at 600. Lots of public urination, and a lot of double parking, including a fire engine that could not get through. They were about 1 second away from actually breaking the guy's window and actually moving the car at one point. So I don't know. I'm probably this is probably one of who knows how many streets in this neighborhood that have the same exact problems, and I don't know what can be done. But some other people were talking about restaurants or bars with liquor licenses. This is a bodega, and it still has people hanging around outside, public urination, the whole deal. Loud music sometimes, and I don't even know what can be done. I'm just throwing it out to you guys to see if anything could be done to make this neighborhood a little bit better. That's it. Thanks.
Okay, thank you. Is that it, Kathy?
Yeah, just want to highlight, because Annette was disconnected, that she wrote what she wanted to say in the Q&A. So I encourage all board members to read it. And Annette Dielli was speaking about liquor license for Cloisters Grill in opposition to, and you can read, I know we're out of time, so folks can read it.
Thank you. Thank you very much. Thank you for the share screen and for keeping the time in such a...
I'm sorry, Eli, I had a question. Somebody mentioned a petition that I don't think it was sent to us by Ebenezer.
Yeah, the petition was sent. And even the person said that she was thanking us for sending the petition out.
Can Ebenezer please resend it to me, because I don't think I received it.
It was in.
Wouldn't this be discussed during the committee report?
Okay.
Yeah. So thank you. So thank you all members of the public for your advocacy and your candor when speaking about issues that affect us all equally. Some noise, some garbage, some revel scootering. I'm sure the homelessness. I think there's many issues that affect us all. So I'd like to thank you for your advocacy and taking the time to be here with us and making your voices heard, which is what's important of this public session. I was gonna go into our special elections. I know that Gail is here, and I'm sure she's going to several other community boards. So I'm gonna have.
I can wait,
you
Mr.
can
Chair,
wait?
because I did all 3 or 4 other community boards already, so I'm
Oh,
fine.
so okay.
Go
So
right
leaving
ahead. I can
leaving the
wait.
best
Go
for leaving the best for last.
Exactly, so I can wait.
There
Go
you
ahead.
Thank you. So we are going to move forward with our special elections. We're going to take 10-15 minutes tops. Those of you who cannot and do not have the ability to maneuver around the technology part of it, just simply take a picture, handwrite whoever you would like to vote for, take a picture and just send it to either Catherine, Nobles, or Ebenezer. Mainly
And
Ebenezer.
make sure you sign the paper with your choice on it.
Choice, yeah, date it and sign it, please.
Right.
So Jonathan, if you will.
I'm sorry, what paper? I'm sorry, Eleazar. What paper? I'm sorry, was I lost here or was not paying attention to something?
I'll repeat it, and I have no
Okay.
issue repeating it. So there are some of us who do not have the ability to click on an email address, vote, and send it back for technology issues, right? Well, you're welcome to just write down the name of the person that you're voting for, sign it, date it, take a picture of it, and send it to Paola or Ebenezer. That counts as well, as long as there's written proof that you voted for whoever it is that you would like to have as an assistant secretary. All right. So Jonathan is going to send you your email, just that you have access to. It's a 3-step process. You're just going to open up the email. You're going to see the choices. You're going to voice out the choices, and then you're going to click on send. It's that simple. If you have any issues, please reach out to Catherine, put it in the chat, call me, Ebenezer. I think that it's not sophisticated. It's not a difficult process.
Eli, when are we expecting to receive this email?
This moment.
This moment now.
This moment now.
Yes. The electronic ballot. We're receiving that by email.
Noble, if you want to expand on it, more than happy.
Are we going to hear the two candidates speak to us or anything?
Well, a virtual world.
Do they not want to? I don't know.
If they can have the floor.
I don't know who the candidates are. I think we should hear from them.
Okay, so if you would like to hear from, we have one position open that based on this resignation, immediate resignation as the secretary. Then Ozzy took over her position, and the Ozzy's position, which is the assistant secretary, is now open. And two people, Daryl Cochran and Rosie Perez. And I'm sorry that I should have went over it. I was just under the assumption that most of us already knew, are not debating, but they all would like to fill in the position. So we would like to hear from both of them, right? First Daryl and then Rosie, in a few minutes, sort of just to explain why they want to hold the position and what they can bring to it. So Daryl, can you unmute yourself?
Real quick, can I make a recommendation? Because we're on speaker view, if everyone turns off their cameras and both Daryl and Rosie turn on their cameras, they should be the only people on the first screen set, so you'll see them both.
Okay. That's a little Zoom pro move right there. Thank you.
Oh, okay, Catherine, Ms. Diaz.
Hello, can you all hear me?
Yeah, I hear you.
Okay, and I apologize, and I have to keep listening to the thing. I am at a barbecue joint in Nashville, Tennessee right now. I just finished a half rack of ribs and a fried pie. That was very good. No, I just wanted to, say thank you so much for your consideration. This position came up. It was something I was very interested in. I was interested before as well, and I just definitely respect on my years on the board OC's work, and would love to help out with that. And I think most of you know that I've served for the length of my term on the Health and Environment Committee, as well as on the Parks and Cultural Affairs Committee under Liz and Steve, and that's been a wonderful experience. And I've just wanted to do more and contribute more to the board. And sorry, I thought I heard something. And I'm sorry, I'm not more eloquent right now, but it's midway through a road trip, so it's a little awkward. But I am looking forward to being back in New York on Monday. So, and also I do want to just, give a shout out as well to Rosie, who in her short time on the board, I think is just a wonderful share. And, there's no bad choice in this. So that's all I really have to say.
Thank you, Daryl. You're in a so much better place than all of us. I envy you. I really do. Rosie.
Hi, Daryl. Thank you for such great remarks. Hi, everyone. I just want to say that I have such a passion for my neighborhood and I want to be more involved, and that is why I'm running. I've also been involved in a lot of work that involves administrative work. I've written minutes in my prior years, and I know the ins and out of pretty much the operations and what goes into being an assistant secretary. So again, Daryl is a great candidate as well, and I appreciate your kind words. And I hope you guys select who you guys think is best.
Great. Great speeches. Both of you. There's no bad choice here, as Daryl perfectly said. I think that Jonathan, I think if you guys refresh your email accounts, I think that you should be receiving them now. So that's pretty much how the process will go along. This is a good pilot for how the general elections will look like.
Daryl might want
Let me mention, I maybe mentioned before that there'll be two people on the ballot. You can vote for one or the other. You cannot vote for both, but you are not required to vote for one or the other. Essentially, you can abstain and vote for neither if that is what you choose to do. Thank you.
I have not received anything.
Just came.
Yeah, literally just got it. I would recommend
it.
refreshing and double checking your spam. Again, it's OPA vote.
Just got it.
So we put both in, but our number one choice is the one that, if everybody else, if the majority of people do number one, then that's the one to pay attention to.
Yeah.
As you just hear, please select one of the two candidates. Vote.
It's only one of the two candidates.
Simple as
You
that.
choose either one, two, you vote, and then you choose, you confirm, and that's it. Very simplistic.
Yep.
I just did it within 5 seconds. It was amazing.
Yeah.
I have not received it. Can someone send that to me again?
Tanya, try refreshing, because I didn't get it, and then I hit refresh, and then it popped up.
It's again the email that you have listed on the board
Okay,
directory.
I just got it.
Is there anyone else that's having issues that has not voted or has not voted yet?
I haven't voted yet. I had to rescue it from spam.
Okay.
This is Glenna Aquino Gill. I haven't received it either, and I've refreshed and checked my spam.
Let me try to double check your email address. Can you please tell us your email address just to confirm we have the right one?
I get them to both of my emails, GAA2105@gmail, and then there's gaquino@armorytrack.com.
Just that you know that I got the same email twice.
Yes, you have.
Vote early and often?
No.
If you have more than one email on our list, I'm sure that you'll receive.
Well, that's a problem though. If you just from my experience, Kathy, yes.
No, I receive it for the same email twice.
Okay.
Just that you
It's
know.
Barbara. It's Barbara. I didn't get anything and I refreshed my browser.
Oh, I was just going to come in. Can I say, can you hear me? Yeah. Can I just say one more thing? And I apologize if this is out of turn. But again, I'm in the middle of Tennessee right now. And I just kudos to Debbie and her committee, but I just hope people support the street co-naming of Healthcare Heroes Way. That was all. Thank you.
Later.
This is Barbara. I didn't get the email.
Barbara, so then if you're gonna, I think like I said, which email are you sending it from?
AOL.com, siempre50@AOL.com.
Yeah, we have that exactly email address here. If you did not receive it, I think you can go for the second option.
Let me check spam.
Yeah.
Get your careers, consumer attention, Costco
Can someone
rewards.
put Ebenezer's cell phone in the chat so I can text? I still haven't gotten the email.
We can't necessarily put the cell phone. What I would say, Glenn, is just email him or respond to him real quick from any of the threads in the one that you use for board email.
Not on the list.
Okay, sounds good.
No,
thank you, Catherine.
Mm-hmm.
Yeah.
Eli, I voted, but weren't we going to take roll call before?
No, we're gonna match the roll call with who voted, so that only the people that are here will be accepted as valid votes.
Just got it. OPA vote. I just got it.
Okay.
Just came
That
in.
explains it. That should have been, yeah, got it.
Took 5 minutes.
You mean 5 seconds?
No.
Consider to change to another email provider.
Anyone else has any issues that we would like us to help us with or address? Glenn, are you okay with? You still need some more help?
Yeah, I'm just gonna, no, I never received the email to either of my email addresses. So I'm just gonna write it on a paper and email it to Ebenezer.
You need his number still?
No, I'll just email it to him.
Okay, good.
Thank you.
All right. So everyone is voted in?
Why does it say 1, 2 on the ballot when you only vote for one?
You just click on one of them.
Yeah, we want you to pick one of them and vote.
So let me.
And if you're sending in the paper, you take, an email itself won't work. You actually have to send us a picture of your handwriting. So, because email is too easy to spoof, et cetera, and you can't vote by email in this state.
That wasn't clearly explained. It was like you're doing preferential voting. Your number one choice is the person you want the most. Your number 2 choice is the person you want second.
All right.
Eli? We're not actually doing preferential voting.
I know, but that's not red.
Yeah, can we stay on track here for?
Excuse me. I'm only voting for one person, right?
Yes.
Yes.
Thank you.
Ebenezer's gonna call you to see if you need anything else. Okay.
Eli.
Yeah.
Would you like me to do a roll call just so everyone say that they voted? Just say I voted, so we know who did not.
Exactly. I was just waiting for everyone to say that they voted, so that you can do the roll call, and then we can match the votes and who you have as present.
So after that, you let me know so I can close the voting process.
Does anyone else need more time?
It took like 5 minutes to get here.
Chairman, I would like to suggest you're doing the roll call.
One thing, Naima,
yes.
Sorry, but as a public member, we have to get through this process first.
Yeah, no, I can't vote. It's just because.
No, not even the vote. It's just during the process, public members do not by bylaws, they don't get to speak.
I was just trying to help so there's no chaos.
I know, but unfortunately, those are the rules. We all okay? Let's get ready to do roll call. Ozzy, since I have no.
Okay, you want me to start?
Yeah, go ahead.
Okay, all I need to hear is I voted. Okay? All right. Marielle Ali.
I voted.
Richard Ullman. Richard Ullman.
I voted.
Francisco Alvarez. Francesco Alvarez. Mary Anderson.
I voted.
Glenys Quino Gill.
I voted.
Wayne Benjamin.
I voted.
James Berlin.
I also voted.
Tanya Bonner.
I voted.
Eli, should I go to you last?
Yeah.
Okay. Daryl. Is he still on the call?
No, he's having another crack at the ribs.
Okay. He's not on the call. Okay. Nobles Crawford.
I voted.
Robin Cruz.
I voted.
Valdez Cruz.
I voted.
Gerard.
I voted.
Catherine Diaz.
I voted.
Naisha Diaz. Naisha.
Naisha.
Naisha. Naisha Diaz.
Not in.
Not in.
She was there. Okay. Domingo Estevez.
I voted.
Gabriela Estrella.
I voted.
Ashley Fernandez.
I voted.
Sarah Fisher.
I voted, but one note. I thought
Don't give me the note. Sally.
First and second choice, because
That's it. I voted. That's it.
Sorry, this is Naisha. My computer was frozen. I did not vote.
Send an email to Ebenezer with your name, the person.
Okay, Faye Flormon. Faye.
I did not vote it.
Send an email to Ebenezer, please. Barbara.
I voted.
Mariela Graham.
I voted.
Juan Guzman. Juan. Miriam James. Miriam James. Not in. Danielle. Danielle.
She was here.
I know.
She's on.
Leo Jimenez.
I voted.
I'm sorry, Danielle, can you repeat that, please?
Oh, sorry. Yeah, I voted.
You voted. Okay, thank you. Joseph Kalinsky?
Yes, I voted.
Thank you. I voted. Betty Lehman?
I voted.
Francisco Lopez?
Yo voté.
I'm sorry, I speak no Spanish.
I did.
I voted.
Thank you. Liz Reader?
I voted.
Maria Luna?
Did too. Voted.
Cindy Matos? I didn't see her. Cindy? Jay Mazer? Jay, I know you're there. I saw you before. Jay, can you please? Okay, I just need to hear if he voted or not. I'll go back to him. Isidro Medina.
Jay, you could speak. Sorry, he unmuted himself, that's why.
Go ahead, Jay.
Yeah, I didn't vote.
Okay. Email Ebenezer, please. Ariel Miranda.
I voted.
Debbie Nabavian.
I voted.
Jonathan.
I voted.
Aisha. Aisha, I didn't see her. Aisha, are you there? Rosie Perez.
I voted. Thank you.
Paradise.
Voted.
Thank you. Christina.
I voted.
Bruce.
I voted.
Etta.
I voted.
Steve.
I was online for 5 hours and finally voted.
Omar.
I voted.
Angel.
Vasquez?
Yes. Sorry.
I voted.
Christopher Ventura. I didn't see him. Christopher, are you there? Curtis Young.
I voted early.
Okay.
remember this being here. But
And this is Daryl. I voted.
Oh, thank you, Daryl. Oh, Eli, I'm sorry, Eli.
Okay, I voted.
Thank you. I'm sorry about that.
Okay.
Okay, so we have,
Wait, can I terminate the system? I mean, close the voting process?
I have 8 people that didn't vote, and I'm not sure if they're still on the call, left the call, dropped
Okay.
out, or
Since you went through the roll call, we are going to officially close the voting session. Thank you.
Okay.
All of you guys for participating in the new democratically, technologically way of voting moving forward until further notice. With that, we are going to release, we're going to close the voting, and then Jonathan is going to go in, get the results, and we'll be sharing them as soon as we get the resolutions out of the way.
Okay,
So,
confirm it. Can I close the voting process?
Yes, that's
All
what I
right.
just.
Okay, stop it now.
Okay, so we are moving along to the elected officials reports. I'm sure Gail has the privilege of being one of the first ones. that has been with. Yes, sir.
Quick question. I thought Ebenezer was going to give, as part of his report, an update on the budget ranking.
I think he did say that only 15 people had only submitted the papers.
Only 15?
Only 15 people. And then we were going to give a day or two so that we can get more people to participate. It'll be 16 as soon as Danielle sends her in.
Okay.
So does that mean that rankings can still be submitted by the 35 who didn't vote?
By whoever voted.
They better.
Hold on, what'd you say about me?
Okay, so moving along, Gail.
Thank you very
Gail
much. So,
Brewer.
yeah, thank you very much, Mr. Chair. And there are a couple of wonderful, good things that happen in Community Board number 12, as usual, but these are really special. One is that I know I was very, very impressed, as you are, with the murals that were done on the restaurants, on the plywood before the restaurants opened, and they were phenomenal. So those plywood murals were then put, when the restaurants opened, against the fence at the Rain Garden. And the question, thanks to the folks who are the amazing Northern Manhattan office of Arts Alliance, NOMA, I call it, you call it, wanted to have a home. And thanks to Natalie Espino and to me, we called Edison Properties because they have a lot of the places where people can store stuff, and they had space and they are offering it for free. So we then worked with the Parks Department, with NOMA, with the artists, the phenomenal artists, the Parks Department. It was a village, it was. And Parks Department bought the biggest damn trucks I've ever seen to move them. They made sure that they were properly wrapped. Then the folks from Edison Properties, Northern Manhattan, and most importantly, restaurateurs. Restaurateurs took care of these beautiful murals while they were on the fence. So I'm just saying congratulations, because I hope that in the future, this artwork will be shown, because it is something, obviously, talking about the pandemic, racism, has a wonderful picture of the very special justice, RBG, and the list goes on. All the lists of the people who've been murdered by police and doves, and it's got everything. So I hope that you're proud of the artists in your community. And in addition, an artist, as you know, has painted right there in Dykeman on the I call the Starbucks building. It's phenomenal, telling people to vote. Congratulations. Number two, a couple of years ago, we went to, I never go to Staten Island. Gail Brewer does not go to Staten Island. But we went for the paper challenge because there is an amazing company there called Pratt Industries. I didn't know, you might have. Every time you have pizza, you're eating from your own paper, because every single ounce of recycled paper, Brooklyn, Staten Island, Manhattan, and Queens, I don't know what happened to the Bronx, goes to Staten Island. And that particular company takes it all and makes, I think, some Amazon boxes, but lots of pizza boxes. Every single pizza box is comes from Pratt Industries. So they're terrific. And they said to I think they did Brooklyn maybe, or Staten Island in the past, but they said to all 12 community boards, we're going to give prizes to everybody who wins during a certain time frame of being the community board that recycles the most. And we're in the 4th quarter. Every borough gets 4 quarters. Community Board 12 won. So I want to say congratulations. It's a big deal. It's a big deal. And so we were going to do a Manhattan Neighborhood Network show, obviously with some press, with your chair. And then I think you can pick 1 or 2, whatever you want, Mr. Chair, in terms of allocation to the funding. So the funding doesn't go to you, it goes to 1 or 2 community-based organizations who you select, and it's up to you. In the past, it's been in the middle of the COVID, it was a food program, but you might pick something else. It's up to you. So I just want to let you know, congratulations. The other thing I want to mention that is also positive is, hopefully, is the work we've all done on 857 Riverside Drive. So we know well that it should not be demolished. We know well that this plan to make it a taller building, to me, is outrageous, and to you is outrageous. So at the moment, we're on hold. I don't know how else to say that. Pause, maybe. With the community board, elected officials, we drafted a letter. We sent it to city planning and the buildings department saying this is a beloved building. It should, in my opinion, be a historic district, but we have not been able to convince the landmarks yet. But I think that DOB, thanks to the letter, thanks to you, thanks to the amazing work of the neighbors, has at least put a stop to any permit that would demolish. That's not the end. It has to do with whether it's a wide street, a narrow street, to make that decision. It's one of those things that if you were looking for Mars, you would look down and say, for goodness sakes, is this a wide street or is it a narrow street? But right now, we have to figure that out. I don't want to get into all the specifics because it's too crazy. I do want to mention in the general, some of the larger issues. I know somebody talked about whether landlords get a tax abatement for empty stores. They do not in terms of city, state, or federal. Sorry, there may be some personal way of working the property tax issues, but it is not, or your income tax, but there's nothing in terms of city, state, or federal tax break for having a vacancy. I have documentation from all 3 levels of government, and every owner says he has to pay the taxes or she has to pay the taxes, but there may be some other gimmick that I don't know. We have a big problem now with small business. I know you know as well as I do. Sorry, it was bad before. When we walked from the bottom to the top of Broadway in 2017, compared to August 2020, there was a 78% increase in vacancies. And of course, I don't even want to think about it right now. We do know that by February 2021, under my bill, the city has to be told by the owner of every commercial storefront property what's vacant, size, square footage, and what the last rent was. We're gonna force them to do that. At least we'll have the data. Right now we have no clue. We just say too many vacancies. I don't really know. So that data will be very, very helpful. We do have to work. We're all working as hard as we can to save as many mom and pops, and then you have some of the best in Board 12. So it's a challenge, and I hope that, I know Congressman Espriella is working very hard to try to make sure that there are opportunities through whatever federal money legislation is passed. Public realms are. Another topic for the future is, what are we going to do to be more supportive of those using our streets? So Community Board 5 is working on the Municipal Art Society's idea. I know that the Times Square bid has also come up with this idea. There are about 20 agencies. We love outdoor dining, but then you have to deal with sanitation, you have to deal with buildings, you have to deal with health, you have to deal with State Liquor Authority, you have to deal with the Health Department, you have to deal with Department of Homeless Services, the Parks Department, Health Department, I think I mentioned DOT, and the list goes on. So who is going to make the decisions about all of these different outdoor spaces? So I am stating for the next administration, I don't know that would happen now, we would love to get your input on what a public realm or public space czar would look like. Even, of course, in Times Square, and you have a great plaza on Dyckman, What does that look like? What happens there? You've got DEP, because you've got people complaining about the noise, as your chair knows. So gotta have somebody in charge so that all these agencies are working together. In terms of funding, I know you're working on it in terms of your suggestions for the community. We're kind of done for this year, but we did, as you know, all the capital. We did 2 rounds for the census. We did the best we could. Washington Heights did pretty well. It was the people who left the city who did not help us in terms of the overall numbers for the city. Although we tried, we did a mailing, I think I told you, to all 35,000 that we got names for from the Board of Elections in their June primary, people who requested ballots. We sent them with the blessing and the support of the League of Women Voters. Some responded. We took out ads all around the metropolitan area saying, fill out the census with your New York City, Manhattan address. I don't know how many actually did, but we had given out grants to several organizations in Washington Heights for census with the governor's money and our money. And we always have some funding for cultural tourism, which we also give out, but it's not a lot, to be honest with you. I want to just mention one more thing about COVID. Boston and the Netherlands, for instance, have been doing something very supportive of public health, which is to do an analysis of our waste. There are 14 waste treatment plants in the 5 boroughs. We know the one at 135th Street the best for Manhattan. In Netherlands and Boston, they do tests, because if you test 6 days in advance, you will know where there is an outbreak of COVID or any other virus. So I was a pain in the neck to the Department of Environmental Protection. And there is a terrific deputy commissioner there, Pam Millardo, and she was like on it. So she finally, I can't tell you how long it took. She got a lab, because you need somebody to do the work. 3 staff people hired who are professional, and now she's waiting for equipment. When she gets all of this, in the past, she would send the waste, believe it or not, to Stanford in California, and then it would come back. Craziness. Has to be done here. Boston, I think as of today, big story in the Washington Post, discovered an outbreak that is going to happen 6 days from now. That is what we need. So right now we can do in the city of New York about 30 tests, 40 tests a day. Boston does a lot more. We need to do a lot more. So we're just waiting on the equipment. Seniors during the entire pandemic were challenged in terms of eating. They are so dying. Seniors in Washington Heights are so dying to be back in their senior center. I don't know when they're going to be opening. Somebody said sometime in November, but I don't have anything specific. I am concerned about the Get Food NYC. I know they're trying hard, but we did do a letter recently. It's on our website to say, you know, these are the issues. I'm still getting lots of concerns about the quality, the timing, and so on. I just hope those senior centers can open, at least for the kind of food that people who are used to it can eat. Really challenging. In November, we're going to be doing with the City Commission on Human Rights anti-bias training for community board members, which has been asked to do. I think you know that there's going to be a NYPD Reform and Reinvention Collaborative Listening Tour. This was the governor saying to the mayor, you know, those two don't get along particularly well. The governor said, I need from every county, all 62, what is your plan for community police relations, etc. So the mayor, as you might know, did appoint the head of the New York Urban League, the head of the Federation of Protestant Welfare Agencies, and the head of the Robin Hood Foundation. I know they've done Queens, and I don't know if they've done other boroughs, but they're going to do all 5. And the Manhattan dates are Wednesday, 10/28, that's tomorrow, for Northern Manhattan residents at 7 o'clock, and Thursday at 7 for Southern Manhattan residents. I want many Manhattanites to get on. I think in Queens there are 150 people. I want a lot more. And I think your input would be phenomenal. Then just on November 23rd, we're doing a tenant resource center. It'll be virtual, and we'll make sure that you get more information. Thank you, Board 12, and congratulations for being the winners. It is a big deal. And we look forward to seeing whom you appoint, and we look forward to continuing a great recycling process. Thank you.
Thank you, Gail,
Thank you.
for that summary of all the things that you've been doing. I don't know how you do it, but I guess you do.
Thank you so
Have energy that I think some of us should have at least 25% of that energy.
Oh, you have it too.
Catherine, the next person, the next representative from an elected official.
Yeah, so I'm just gonna call out names because I see you. I might have not noticed a few because there might be new ones. And if you don't plan on speaking, just let us know. So I have Manuel, Orlando, Philip, Chris, Kiana, and Lori.
And we're
Starting with
gonna
the early
have
birds.
with the special
So if I missed you,
caveat,
raise your hand.
the special caveat of having the timer right behind you guys. 3 minutes for the first time.
All right, Manuel, are you speaking tonight? I don't think you are. All right, we're gonna skip. I'm gonna just go on straight to Orlando.
Hello? We're not doing questions for Ms. Brewer?
No more questions for you, Francisco.
Hello. Can anyone hear me? Check.
Yes, go ahead. Sir.
Very quickly, just one thing. I don't know if I'm talking or not, but I wanted to let you guys know that our office, hi, my name is Manuel. I work for the Office of Council Member Marc Levine. Just wanted to let you know that this month, we had our monthly food pantry. We'll be having another one on November. This one will be doing some sort of special Thanksgiving turkey giveaway. That'll be on the 19th. So you can call our office at 212-928-6814 for more info. And if you know of anybody who needs it, please give them our number. The date again is going to be on the 19th of November. Thank you very much.
All right, great. Next up, we have Orlando from Assemblywoman Carmen De La Rosa's office.
He just did. That was Orlando.
Lord.
No, that was Manny.
No, that was Manny from Councilmember Levine. Yes. Hello. Hi everyone. Can you all hear me?
Yes, we hear you.
Hi, how are you? This is Orlando. I'm Chief of Staff to Assemblymember De La Rosa. For our report this month, we have the Assembly member have done some stuff legislatively. We actually signed to the Furious Act, which a lot of the members expressed concerns last board meeting, and she's also co-sponsoring the Sleep Act, which is a bill that actually calls for increases in the max fine and for increases in the fine for certain vehicle violations, and also for the Excel systems, because it's something that has been affecting the community throughout the whole summer, and people are complaining about that a lot. And I've seen it myself. We've called the prison as well about that. And the Furious Act is pretty much to have the speed zones, the speed cameras on throughout the whole night instead of them having shut down at some point. And they'll identify areas of concern for illegal street racing. We held a press conference last Friday at the Tapas y Mas about the early voting and the importance of people having to plan to vote, whether it's by absentee ballot, by mail, or early voting. So that was really successful. We had a lot of media coverage, and also we went to a meeting at the call from one of the board members that actually had a meeting in 600 West 107th Street, and which is the building where one of the board members lives. So they had a community board, not a community board. They had a tenants and landlord tenants meeting there, where they were speaking about some of the concerns having to do with repairs and some of the landlord negligence on maintaining the building. Also we've also partnered up with Alianza País for the cleaning of the Juan Pablo Duarte Square Plaza that happened last week, and we've held food pantries throughout the month. We did one of the small businesses in the area. We also did one with Kingdom Earth, which is a Marble Hill not-for-profit, and we partnered with School in the Square to do one last Saturday, and we're gonna continue to do more. So stay tuned. And then upcoming this week. We have Halloween paint, Halloween trick or treat paint day, which we're gonna have an artist come and paint with the children in Eagle Hill Park, and we're also gonna do the distribution of candy in our office on Saturday. We partner with Walgreens, we partner with Fidelis Care, and Dominicanos Pro Ayuda a la Niñez. And
Thank
that's
you,
pretty-
Orlando.
Thank you all.
Thank you very much. Thank you so much. Enjoy
All right.
your summer.
Next up, we have Philip Ellison from Public Advocate Jamani Williams' office.
Hello, can you hear
Mr.
me?
Philip, you with us?
Can you hear me?
Yes.
All right, CB12, pleasure to be here this evening. Always good, and I was really glad to see some of the community members and the staff at the street naming in the district. I'm a Hostos alum as well, so the doctor who the name street naming was named for, hugely important to the city and to Hostos. So thanks for having us there from the Public Advocate's Office. A few brief announcements. I'm not going to keep you long. I just think it's important to note, on two fronts. One, the Public Advocate is continuing to push the mayor and call out the confusion and express the reality that we as a city are essentially trying to have a return to in-person learning as COVID cases are rising, and we have not had the ability to have the proper outreach and submission of devices for our students in the city who have yet to have a device to be able to do online learning. And so instead of that expansion of going back, really emphasizing the need for making sure we have the devices and we're being safe and not having the confusion. So we're pretty adamant about that in our office. Also, two points of legislation. The Public Advocate recently released a legislation package supporting small businesses, COVID-19 and the front lines and the workers. And really on two fronts, that is Intro 2125. It's really guidelines and then the safe reopening that looks and puts together from all this federal, state, and local laws the best practices, especially as we've reopened even further for our businesses. There hasn't been that full out kind of collective work legislatively on reopening for small businesses. We also have a second bill requiring the Department of Small Services to report the impact of COVID-19 on small businesses. This is really a data bill. There's a lack of data reporting on the amount of revenue lost due to the virus, any jobs or positions eliminated, permanent closures. And we need data to see what's going on in our communities when it comes to our businesses, when it comes to our education. So we're really a data-driven office, and we put in legislation and local law that we're trying to make sure we're using data in response to COVID as we enter a phase 2 in our city. And lastly, just a remind, keep abreast, keep a lookout that we are doing a redefining public safety campaign from our public safety health equity team. You all in this community are talking about redefining public safety, really, right? And so I'll make sure as those items come out, I'll share that with your chair. You have a great chair on that front. And I'm going to make sure I send the email out to your chair so that you all can get access to some of our online virtual events on our homelessness and so forth. So that's all I got. Thank you for your time.
Thank you. And the doctor's name, Philip, was Dr. Michelin.
Michelin, yes.
Michelin, former, one of the former dean in Hostos Community College, one of the founders, and also the Dr. Lincoln Hospital, one of the first Hispanic doctors there.
What an impact. What an impact.
Yes. Thank you for being there. Really appreciate that. Catherine?
Yeah, all right. Up next, we have Joanna Garcia from Senator Robert Jackson's office.
Hi, everyone. Good evening. It's been a great meeting. To give an update on what the senator has been up to, he was a prime moderator for Hispanic Federation's national event on education. He hosted Randy Weingarten as well as superintendents from Chicago and California to review the impact of COVID-19 on education. As you heard from Sally, we had a parks cleanup. We also had a food distribution event with Fidelis together with St. Jude's Church. And we've been working on Fairview with Uptown Community Church, planting trees and to clean up the area. What's coming up? Coming up as soon as tomorrow around your lunch hour, we're having a tenants info session together with Met Council on Housing and Mobilization for Justice. I encourage everyone to attend to get information. We also have a flu shot mobile van throughout the month of November. It's starting next Friday at Marble Hill, and it's going to be every Tuesday thereafter. And it's going to be Dyckman Houses, La Placita, 159th Street in Amsterdam. We're also having a Dias de los Muertos event, and that will be on November 1st. We'll provide the information. Legislation-wise, this Thursday, we're having a press conference on our bill expanding family leave to accommodate for parents who are helping with remote learning. And that's going to be together with a Better Balance and Vote Mama. And in terms of announcements, we've communicated with the MTA regarding the shutdown of the A train this weekend. We're concerned about how that's going to impact early voting. So they have agreed to provide additional buses as well as to mitigate traffic in the Nago area. And I just want to make an announcement. I don't know if it was mentioned before, but the hours of early voting have been extended this weekend. It is now Friday, 7 a.m. to 5, Saturday, 7 a.m. to 5, and Sunday, 7 a.m. to 4. So it's 2 additional hours every day of the weekend. I encourage everyone to vote. Thank you.
Thank you, Joanna. I am so sorry.
Yes, sorry, I'm back. Kiana is up next from Councilmember Yanis Rodriguez's office. And I'll put the time. Sorry about that, everyone.
Hello, everybody. This is Kiana Diaz from Councilmember Danis Rodriguez's office. Some quick updates. This previous week, there was a hearing on mopeds and e-scooters at the Transportation Committee at City Council, where they discussed a legislation that the council member introduced, and that's Intro 2061, which will mandate for the Department of Transportation to create guidelines for moped sharing companies so that they can adhere to, to create guidelines that moped sharing companies can adhere to before they can operate in the city. In that is also the request for the Department of Transportation to explore the possibilities of monitoring riders who do not wear their helmets. Tomorrow, the MTA is also going to be having a hearing where the council member is going to be providing his testimony in support of the federal government, providing the MTA with federal funds to help them out. Currently, the MTA has a $12 billion deficit, which if it continues will mean that there will be no money. The MTA would not have enough money, and we will have to deal with fare increases throughout the city. There will be massive layoffs, and there will be a decrease in services, which we cannot afford because COVID. There was a hearing in regards to TLC response to COVID and driver's assistance program, where they discussed 2 of the council members' bill that will be introduced on Thursday. One bill is to suspend monetary liability for parking violations issued to essential employees from the beginning of the COVID-19 pandemic to September 30th. And the second bill is to suspend monetary liability for parking meter violations for New Yorkers beginning from the COVID-19 pandemic to September 30th. We had a street co-naming this past week. We co-named 166th Street and Audubon Avenue, Nassari Michelin Way, in honor of Mr. Nassari Michelin, who was a renowned doctor from the Dominican Republic, and he was the first Latino in New York State to be named director of a hospital. We've also been getting ICE cases. We specifically got 2 cases recently where ICE is identifying themselves as not only New York police officers, but when they're knocking on the door, they're saying that they're from the 34th precinct, which is a lie. And we're going to be having a co-naming on November 1st in honor of Don Carlos Martinez. He founded an Alcoholic Anonymous group uptown after himself suffering from alcohol dependency. And he became the president of his specific group, and he has done great work in the community. And that's going to be on November 1st, West 165th Street and Audubon Avenue. That's it. I'm done. Thank you, everybody.
Thank you. Great timing. Thanks.
Yes. So next, we have Lori. Where's Lori? Lori, are you there?
I am here. Can you hear me?
Yes.
Okay, great. So as I think is known to one and all, I work for Congressman Adriano Espaillat, and I'm just going to share a few highlights of things that he has been involved with that represent the concerns of the community and above, the locality, so to speak, things that are timeless concerns and issues. As I'm sure most of you are aware, the center in Georgia, in Irwin, Georgia, where women have been held, people who have attempted to enter the United States, and there is a wide ranging investigation into the reports that these women were subjected to unwanted, unnecessary, and unexplained gynecological surgeries. And we are still waiting for a response, but he has gone to visit and speak directly with these women. On a more positive front, I'm not sure that I remembered to tell all of you that the congressman took the lead on renaming the Audubon Post Office at West 165th, the Normandia Maldonado Post Office, in honor and in memory of the impact and selflessness of this woman within the Dominican community. Decades ago, her visionary leadership was a driving force behind the Dominican people's interaction and involvement with the communities of Washington Heights, Inwoods, the Bronx, and beyond. Her altruism and contributions were of many colors, and her artistic vibrance was revered and cherished. She helped the Dominican people build their own legacy, and she forged the efforts to establish the Dominican Day Parade.
Thank
so
you, Lord.
We are very pleased to have taken the lead in honoring her in this way. Thank you.
Thank you. Thank you very much.
Okay.
That's
it for elected officials, yeah.
Okay.
There was an announcement from Wendy Olivo from Al Taylor's office.
Is she there?
No, she kept getting kicked off the call, so she texted me a flyer and just asked me to please announce that the assembly member is going to be having a forum and panel discussion on domestic violence in conversation with Tricia Phillips, the ADA, Indira Castro from the Manhattan Borough Family Justice Center, Maria Lizardo from NIMIC, Stephanie McGaw from We All Really Matter, Shernice Gatewood Alley from We Are Phenomenal Women. That's on Thursday at 6 p.m. And I'll send the flyer she'll send the flyer to Ebenezer in English and Spanish so that people have the Zoom sign up information.
Okay, thank you. Natalie, I'm sure you have some other things to report out of what Gail just mentioned so that we can move on to our committee resolutions.
Thank you, Eleazar. Natalie from the Borough President's Office. I do not have anything to add to what we prepared for her remarks, but I did want to, she had asked me to put the details on the police forum up in chat, and I don't have access to the Q&A, but I know that you folks have blasted it out to your subscribers, so I thank you for that. So anybody looking for those details can contact me or look into the CB12 emails for the details of the tomorrow night's police forum. And anybody who had follow-up questions on the Borough President's report, as always, NESPINO at manhattanbp.nyc.gov. There were, please look at our website. There were 5 CB12 organizations who did receive the grants for the cultural tourism. So arts and culture is active and thriving even with this shutdown. Our arts never closed. It just shifted, and it's essential to our businesses reopening and our people healing from these experiences. So thank you.
Okay, so it's 9:05. Hopefully we can get as much as we can and leave as early as we can. It's been 2.5 hours of plenty of information and plenty of good stuff. So I'm gonna move along to the committee resolutions. I'm gonna try and do something new, which is to have both chairs not only present their resolutions, but also present their reports within the same time frame, so that we can expedite our time and move forward as soon as we can. So Debbie, you first one up.
Thank you, Eli. Just the only thing I
Hey,
want to
I'm
say
sorry,
about,
Debbie. Sorry to interrupt. Before we get started, what's the timing on here? So I can share the timer.
I don't.
There's
Let me
3
just say I've got
resolutions.
3 resolutions, so I can go as fast as I can, but 3 resolutions are 3 resolutions, unfortunately. So let me just begin. I just want to make one announcement to everybody. 181st Street 1 train station will be closed starting December 5th for their elevator replacement. What this means is that 191st 1 train will be open arguably more than 2 months early, because it will have to be open by December 5th. So the good news is that will be open in less than 12 months. The bad news is we're about to have a whole subway station closed at 181st Street 1 train. Moving directly, everything else, please check the minutes. First, I have 3 resolutions. I'm actually going to flip the order. I'm going to start with the traffic related one. Then I'm going to do co-naming, and then have Daryl Cochrane finish with the Healthcare Heroes co-naming. The first resolution that I'd like to speak to is the one that says request DOT to evaluate bike lane and traffic calming proposal for Riverside Drive from Broadway to Staff Street. I would highlight that we've heard a lot about Henshaw, and this sort of touches upon that on the Riverside side. There was a proposal that was presented to the committee this month related to Riverside Drive west of Broadway, because the bike lane has been severed with the dining plaza on Dykeman between Broadway and Seaman. We now sort of have lost our connection both to the Greenway and to the bike lanes to the east of Broadway on Dykeman. So there's sort of this innovative idea to make the westbound Riverside going towards the highway entrances 1 lane, creating a protected bike lane, and then therefore not losing any parking. And then this would not only restore the bike connectivity to 2 important sort of to the Greenway and to the east, but would also sort of address in part speeding and sort of aggressive driving on Riverside. What you are looking at now, I think the salient thing to focus on here is this is not a resolution in support of the bike lane proposal per se. What this resolution is doing, it is asking DOT to evaluate the proposal, but also evaluate the traffic conditions on that stretch in its entirety. And in part because we certainly get a lot of reports of people exiting the Henry Hudson at speed, and as well as that left turn on Henshaw that we heard a little bit about tonight. So that's that first proposal. I'm sorry, the first resolution. The second resolution that I want to address is the co-naming of the corner at Dykeman and Nagel to be Isaiah Che Maranta Way. I think my committee will certainly knows that this was really, really a big one to experience in committee. Isaiah Maranta is the 13-year-old that was lost as he jumped into Spuyten Duyvil to save a friend who was drowning. This happened just at the outset of the pandemic. It was a tragedy of such unspeakable proportion. When this was presented at the committee, it was, I think I was honored to sort of have to get to know this person a little bit through his parents and through the presenter, Angela Fernandez. He wasn't just, I think what they spoke about was, he died in this heroic act. So his heroism is the headline here. But it was clear through the stories of people that reached out to the parents afterwards and told their stories of that this was a person only 13 and a half who clearly impacted and left a mark with whomever he interacted, as a good friend, as a sort of big brother, as an upstander standing up to a bully on behalf of somebody. He saw what people needed and he seemed to act. And so the resolved, we're trying to capture here that this is an opportunity to not only honor this hero, but to preserve his story as part of our history and the history of the neighborhood. And to hold this spirit of somebody who so positively affected people of all ages, not just his peers, his kid peers, but really across ages is what we heard. And request that the New York City Council designate this corner, Isaiah Che Maranta Way. For those that live in the area or may have been by there is a mural up for him. But again, this committee was certainly, I think I can say on behalf of everybody, honored to get to know this person, for those of us that didn't know his family. And that is a family that the parents both grew up in the neighborhood. They both attended schools here. They're very well known. Then this one was a tough one. What a loss. And with that, I want to, for our last co-naming, I think many people know that Daryl Cochran took the lead on this vision for this Healthcare Heroes Way, and did all the footwork of making sure that there was a petition, etc. And let me just see if we can get Daryl on. I was supposed to text him. And if not, I will just.
I texted him and he told me.
I'm here.
Oh.
Okay, great.
I'm here.
So I'm
My
gonna
battery's
hand it to
running low.
you.
I apologize.
We have a few more minutes, guys.
But yeah, no, if I could, Debbie, I would just say, thank you to your committee and its work, and to you especially. I think this idea came, from a lot of what the folks at New York Presbyterian and Columbia University Medical Center were doing, and we also know that there's so many healthcare workers not affiliated with those entities that live in our neighborhoods, and just also there have been wonderful suggestions in this process by so many, Jim, Tanya, Maria, Debbie, and I'm forgetting some folks, but and this really honors not only, you know, the doctors and nurses, but also everyone involved in the process of helping folks with COVID, you know, including from janitors and chaplains and, you know, food prepare workers. It's just everyone involved who sacrificed, you know, during one of the worst healthcare pandemic of our lifetime. So thank you.
Okay. Is that the second or the third one, Debbie?
That's it.
That's it. Beautiful. Great timing.
Are we taking any conversation or anything on any of these topics?
Not at 9:15.
I-
Maybe at what at the time of voting. Maybe.
Can I get, well, this is the time of voting. This is when they make their presentations.
Now we vote at the end of all the all the resolutions.
Right, but we have discussion.
In the time we're having the back, I mean, do you want to just put something in the Q&A and I'll take a look?
No, I would like to make some comments.
Well,
Usually
Steve,
when people,
wait.
the chairs present their resolutions and we discuss them before
What are you
we
looking?
vote
What
on
are you
them.
looking for? A friendly amendment or some sort of change?
No. I know that there's been a lot of controversy about bike lanes and whatever, but I want to strongly recommend and beg everyone to please vote in favor of not only the street co-namings, which I think are obvious, but the request that DOT do this study. We really routinely have people flying off the Henry Hudson Parkway and endangering life and safety and property. And I really need for DOT to like do their professional evaluation thing and come up with a solution for us to consider. So please vote yes on that.
Yes.
I also had something.
Indeed.
Yeah, Steve and Danielle had their hands, by the way.
Yeah. Can I go ahead?
Yeah.
So
Steve.
Yes.
And then Danielle.
Danielle's talking.
Oh, Danielle was
Steve
first. Who was
and
first?
then Danielle. No, it was Steve first and then Danielle.
Okay.
Okay, I have quick comments to make on all three of them. On the first one, Debbie, the first two whereas clauses are basically the same. They're repetitive. I think you need to eliminate maybe the first one. In the last whereas, I just want to point out that if this proposed bike lane along Riverside Drive, I don't know that it would provide direct connectivity to the Greenway because the bikes would have to zigzag back to Dyckman Street to link up with the Greenway at the far end of Dyckman. On the second resolution, did you have a particular corner in mind for Isaiah Che Morante Way? Is it the northeast or the northwest corner?
No, I know we're sort of meant to, but yeah, I know that's an open item, but I do not.
Did he live in Dyckman houses?
No, he lived in
across the street.
So it probably should be the
The
northwest.
location, I'm sorry, the location is Dyckman.
What is that?
The location is Dyckman and Maple by the mural, by the family building where the mural is.
We can't right across the street.
So shouldn't it be the northwest corner?
I don't know direction, but whatever that is, yes.
All right, well, I think that should be considered a friendly amendment. On the
that's where Dyckman begins. Dyckman doesn't begin on the southwest by the project.
No, Dyckman begins all the way over at the Harlem River Drive.
10th Avenue.
Yeah. On the Healthcare's Heroes resolution, I just want to make a statement. I'm in support of the resolution, but I believe it's very unfortunate that the New York Presbyterian Hospital has refused to provide this board with basic information about how many COVID-19 patients it has treated at its uptown facilities during this crisis. This information would have made this resolution much stronger since it would have given us a clearer idea of how the hospital handled this emergency and how many patients' lives were saved. It's inexplicable to me why the hospital would have an issue providing us with this information.
All right.
I mean, I will say the hospital did give information for the totality of all of their facilities.
Okay, that's not what we asked for.
Okay.
I understand.
All right.
Danielle?
And okay, Danielle. Unmute yourself.
No, she's unmuted. Just speak up a little because you were coming through very low.
Can you hear me?
Yeah.
Sorry. So just two super quick things. So the first thing was related to what I believe Steve said about the bike lane. If it were to go along the Harlem River, if it were to go along Riverside, it wouldn't necessarily connect directly to the Greenway. So I guess I was just wondering about that, but also isn't just a temporary street closure on Dykeman? And then the second thing I wanted to know about was the parking and how are you going to preserve parking if it's going to be a 2-lane bike lane? I imagine it's going to be pretty wide, and I don't know if there'll be enough room to preserve the parking on that side of the street.
So I'm sorry, two things. One, when I asked the question about the connectivity, the answer I got was that for bicyclists, many of them actually choose, because they can't really use Dykeman that well. So usually like double parked and whatever that they can't. So they basically, what I was told is many bikers, they just use the steps regardless because there aren't so many. But in all cases, yeah. So that was that. And then the
Hey Debbie, I just want to make a clarification on that. It's what it seems like is that what I'm hearing from the board is that everyone assumes that there's only one entrance to the Greenway, that it's on Dykeman only, but actually there's two entrances. It's the Dykeman one that's impeded right now due to open streets, which actually is now almost like a permanent open streets. It's not something that's going to go away. The second entrance is what this is addressing. There's another entrance to that Greenway that happens right after Staff Street. So this is giving access to the Staff Street side because open streets has impeded the direct access to the Greenway all the way at the end of Dykeman. So just an alert that there are two entrances to the Greenway.
Thanks, Omar. And then just to
isn't
address
the one at Staff Street a difficult one to get on?
Well, but let's just one at a time.
But I think we've got enough on that point now. That for bicyclists, that's not perceived as broken. It's just because it doesn't get over to Dykeman. But the thing on the parking is that the bike lane would be to the far right or the far north on the westbound side, and then you would you'd have the parking. So all the parking would be retained, and then you would have one lane of traffic rather than 2 lanes of traffic going west. So that's the sort of idea that was presented that we've asked to be evaluated. So it's that thing where the parking's just not next to the curb anymore, and then you get the protected bike lane.
Okay. Any other questions on the bike resolution? Martin Collins just got a text from him just pointing out that it's the northwest corner of Nagel Avenue and Dykeman.
Yeah, Liz got to me. Thank you.
All right, good enough. Okay.
Appreciate it.
Thanks, Deb. Isidro?
Wait, Elisel, does Debbie accept the friendly amendment to add that or no?
To add what?
I don't think that there was any.
I believe Steve made a friendly amendment to add the northwest into the resolution.
Well, yeah, no, I'm sorry. that was my gap. Street namings need to designate a corner. So
Yeah.
yes,
And the two repetitiveness on the results,
I'll combine the language.
on the whereases. Okay, Isidro?
Thank you, Chair, for giving the opportunity to present tonight. I would like to also thank Ebenezer and the staff members at the office for putting together all the paperwork and all the documents. Also, shout out to the committee members, Cindy, for doing the minutes, and also for Rosie for writing down the resolutions. Thank you guys so much. Really appreciate it. Also, very grateful for board members that showed up to our board meetings on last couple of Wednesdays ago. It's really nice to see every now and then. Liz, thank you for your input. Always trying to bring solutions to issues that we have on the committee and also in the community. So thank you so much. So we're going to vote on resolutions tonight. you will not vote on agenda item number 10 and 11 because they were withdrawn. So you're not voting on agenda item number 10 or 11 because they were withdrawn. So I heard some of the concerns about some of our agenda items, and they're very legit. Let me just start with agenda item number 7. A lot of comments there, and some of them, again, had lots of merit. The reason why the committee tended to vote in favor of this resolution was because the hours of operations are not prohibitive, meaning that closing around 7:30 at night is not really something that's going to escalate to a night, to a club or a lounge. Those are our main concern. We understand that this street has a lot of problems, a lot of issues, but taking into account that they open up only until 7:30 at night, that's something that we considered when we voted. We also noted that for this particular merchant, they already were approved for a resolution back on last year, precisely close to a year ago, on 10/28/19, by a vote of 36 to 1. So it seemed that, back then they had the full support of the community. Taking into account that we do have a lot of residents complaining now about this getting a full liquor license is something that, you as a board member will have to decide. There was a question raised about the space being close to a church or a place of faith. We understand that, whenever there's something close to a place of faith, that has to be considered. Since we don't have measurements or the right to do measurements, that's something that's going to be taken up by SLA. The SLA will come and they'll measure up, and if there's any problem, they will not get the full liquor license. That's very clear. So I'm on board with that with you. Taking that into account, we also requested some stipulations for this particular merchant, which required, posting on public notice about mobile parking. And we also indicated that they should have a phone number publicly displayed. If there are any issues, they can call the manager there 24/7. But of course, they're not going to be there until like 7:30 again. So we based those stipulations trying to take care of the issues that some of our residents might have, as far as like agenda item number 7. Now, agenda item number 8, I hope that we had seen those petitions that were signed by residents. It's important that we respect what our residents have to say, and having a collection of over 200 signatures would be something that I'm sure the committee will take into account. Again, the same issues about this agenda item 7 and 8 is similar: traffic, noise. The police is very cautious about this particular area because of sound and all of that. The committee felt, however, that this should be enforced. This is an enforcement problem. And it was stated by one of our couple of members in our committee that we do have to give new businesses a chance to come in and make business, even though the area might not be the best spot to put a bar or a lounge or a nightclub or a restaurant. Very concerning, the fact that many people brought up the issue of having this close to a school. As you know, there's a charter school, and of course, the George Washington High School is close by. Those are very valid concern, and we understand that. So, the fact that we have so many residents complaining about this particular spot is something that we have to take into account. But when the committee voted at the very end, it was weighted out that this business person should be given an opportunity to see how they work, to see how they function, and if things don't go well, that they can always, the resident can come back and bring those issues back to committee. Very tough decision to make. I understand that, I'm very grateful again for Gabriela to come in as our board member and highlighting some of our problems. These are issues that we don't take lightly, but based on the things that we were said about offering business an opportunity to do well is something that we considered. And we thought about all these different topics when we voted on this particular agenda item. I would have hoped that there was a public notice displayed that it was said that was not put either on 7 or 8. That is very concerning as well. So when you do vote, do take this into account and weigh it out on your vote. If I missed anything, fellow committee members, feel free and jump in, even when questions are asked. So at this point, I would like to open up for questions.
Catherine, help if you want to.
Bueno, we got 7 hands.
7 hands.
Okay. Mm-hmm.
All right. Let's keep them short too.
All right, I'll put the timer on. What's the timer? I believe is what, 2 minutes?
2 minutes on 1 minute review.
All right. We're gonna start with Gabriela.
Mm-hmm.
Gabriela, you can unmute yourself.
Thank you very much. I'm going to try to beat the 2 minutes. Isidro, thank you very much, you and the committee members that allow me, to participate in this issue. That is an issue. And as I said in the committee meeting, I'm going to repeat it again. I am not against business. I am not against, anything that will put food on the table of people. But there's places, establishments and places. This establishment is not for our location. As you may know, I live in 11 Fort George Hill, which is one of the Michelamas right across from that location. And this area has been tremendously saturated by noise pollution, by many other things. And yes, we have not only George Washington High School, and as part of the Youth and Education Committee, that's a concerning issue. As part of the Public Safety Committee, that's another issue. and as well as another charter school that we have in the corner. This is a residential area. This is not, a mom and pop business. This is a big establishment that is not really fitted to be in our neighborhood. And again, I am not opposed to anything that has to do with bringing food on the table to people. But this place is not for our neighborhood. And I will appreciate that you oppose to this resolution. And again, Isidro, thank you very much for allowing me to speak in your meeting last week. Thank you.
Thank you.
All right, next up is Nobles.
Hey, thank you. And taking Liz's advice here, I will speak during this comment section. Thank you, Liz. Folks, I don't usually speak, about businesses in the licensing committee's resolutions. But Cloisters Grill on Hinshaw, I definitely want to mention here. Putting on my state committee hat here for 2 seconds, if I could. I know this area extremely well, not only living on Cabrini and walking through to Dykeman a lot, but also too, I do have constituents that live around that area. If you look up 7 Hinshaw on Google Maps for folks that haven't been there before, this is the most internal of an internal street that you can get. So when you think about that, think about the acoustics. This is a residential area there. There's plenty of places, to go to imbibe in, have some fun, that are more open streets where the sound can be more diffused. This is on the internal street. And so when some of the members of the public were speaking to the potential factor that having a liquor license here could cause in terms of the welfare of the constituents around there, I'd like you yourself to put yourself into their shoes and look again at Google Maps at 7 Hinshaw and see what that could sound like. There are already a lot of issues that we know about in this area when it comes to noise pollution. This would only be adding to it. So just to wrap up here, give you 30 seconds back, Catherine, I would definitely ask for the committee members to look at the street and then also consider joining me in voting no on number 7 Cloisters Grill. Thank you.
Okay, next up is Olsi.
Hi, Isidro, I just want to say that I don't think we received the resolutions. I saw the minutes, but not the resolutions.
Resolutions was sent late yesterday because I had to make some edits, and they were sent out last night.
Okay, guess I didn't receive it.
It's in the email Chanel sent with all the attachments. I just opened it. And the petition is there as well that you asked earlier.
If I may, also correction on the resolutions, and thank you also for bringing that up. The hours of operations that you see on agenda item number 7, those are the hours that are going to be set on the resolutions. The resolutions do have the wrong hours that are closing. The one that really matters are the ones on the minutes. Thank you, Rosie. Next.
Next up is Barbara. Barbara.
Concerning the Buddha Bar at 11 and 17 Fort George, I live in the Mitchell Lum at the bottom of the hill, but I certainly stay in touch with my 11 and 17 sister Mitchell Lamas. I draw to their attention that 11 and 17 that are right across from the Buddha Bar are NORCs, naturally occurring retirement communities. Those are special buildings that have a very, very high concentration of senior citizens. They receive special supportive services. They have considered to be a high concentration of fragile seniors who receive visiting nurse services every day, and a lot of minor medical support, which is to keep people from going into nursing homes or assisted living. They cannot have a club across the street. These are people for where if they lose a night's sleep, it is something that can be a medical emergency. These are NORCs. So I really, it's cruel to take sleep from residences such as this, cruel. So I really bring that up. And I don't know if that was brought up in the other discussions. And if you had looked at board stat in the licensing committee meeting, and I do bring forward that I think board stat should be looked at every time, you would have seen that there's been numerous complaints about Buddha location already, even before they've been asking for this full liquor license. It's been a problematic location. I think Gabriella spoke to that already. So it's not something that we should be going forward with and expanding, not at that location, not across from NORCs, not so close to the schools, and not across from a church. And I disagree with you, Isidro. It is the responsibility of a community to identify.
I'm sorry, time, Barbara. Time, Barbara. We got 5 hands and it's already 9:38. Next up is Sally.
That should be the end of the
Thank you, Isidro.
session.
I guess I'm a little confused by some of your comments. You said it's an enforcement problem, but we have to give businesses a chance. Yes, it is an enforcement. In fact, according to the residents who testified, it's chaos. So I wonder at what cost. Like Gabriella, I'm pro-business, but not when it destroys quality of life and sleep and all that other stuff for neighbors. Second, you said that you couldn't take measurements, but you would consider them. The community did take measurements, so would that change your recommendation? And finally, I guess you said you wish you had seen the petition, but you hadn't seen it. That would also have been considered. So given that we have measurements now, we have a petition, and we think that residents and their lives are just as important as businesses surviving, how would you change your recommendations?
Thank you, Sarah. So the idea of saying that enforcement is a problem, we have a big enforcement problem here in Washington Heights and Inwood, because the enforcement are only placed on some businesses. When it comes to the quality of life, there's no consistent enforcement. The dirt parks that are going on around the street and many other issues are never enforced. And they cannot be the fault of some businesses. I'm not defending some businesses that are not doing the legit way of conducting business, but the many issues that we have in our community are not 100% enforced. As far as your recommendation about flipping this resolution. I would like to hear before I make the decision with Leo. I think that you were the one that highlighted the idea about giving business an opportunity. And before I were to make the decision of flipping this resolution, I would like to hear from you about what you have to say about giving businesses an opportunity. Leo.
Yes, thank you, Cedro, and hi, everyone. Good evening. So when we made the decisions on the couple of licenses, we took into consideration that a lot of these are small business owners, they're first-time business owners. We're in a very tough time with COVID. There's a lot of shutdowns, it's been really tough for a lot of people to get on their feet. A lot of people have also, in our meetings, stressed that you need the liquor license to be able to stay afloat, to be able to pay rent. Rent's pretty high in our area. So when we took the consideration as a group, we kind of brought it down to, hey, is the complaints coming specifically from the business? Someone brought up the point that Buddha had a lot of complaints. The business owners representative told us they have been closed for the last, I think, 8 months to a year. So I'm not sure what complaints are specific to that, maybe construction, but I can't specify noise. Also, we did pass a couple steps to make sure that we do right by the community, that we do serve our community. I'm still gonna stick to my original vote. I don't think it's fair to punish these businesses, especially during these times, especially if they have no prior incident or prior issue with the community.
This is Maria Luna. I
Okay.
cannot be.
Wait, Maria, you're out of turn.
Okay.
Just let me explain something.
But
I would like to be acknowledged on this issue.
yeah, but I'd like to, Maria, to be fair.
No, that's fine.
To be fair to those people that raise their hands, how many people do I have ahead of Maria?
Well, originally we only had 3 names left, and then now we have 3 additional hands for
I think
Maria.
there's 940. So let's just kind of like go through just the first 3 that you had there before, and then go to Maria, and then we're gonna call it a day. We all have a shot at just voting, and just make a decision on these issues.
Right.
Hey,
so
I got a point of clarification. What Buddha is this? The one on Broadway? No, St. Nick. It's a new one.
It's a new Buddha. It's not Buddha Beer Bar on Broadway and 192nd, which is not on this list. It's Buddha, which is unrelated on St. Nick and 192.
All right. So
take it back.
I'm sorry. Can I say
no,
something?
Wait.
No,
I can't allow the meeting to be hijacked. Catherine,
not
go to
being
the person.
I'm not
Whoever the next
hijacking
person
this
is.
meeting.
Wait, let me go back
Just
to
go
what
to
the
the next
stacks
person.
was.
Because I had my hand
when
up
it
and
was,
you're taking Maria and I had my hand
no
up.
one's taking Maria.
That's not
No
fair.
one's
No
taking
one is
Maria.
taking
Maria's the
Maria, okay?
last person. Maria was the last person. Originally, there were 3 when he called that they were going to take the last 3, and that was Steve, Liz, and Faye.
But I had my hand up.
Yeah, when Isidro started
go ahead,
speaking, then
my hands up too. Please allow the committee members also to express their opinion.
Of course, yeah, as with order. Everything will be done through order. Catherine?
So Steve.
2 minutes.
Dave, speak up.
Steve, you're on mute. If not, moving forward to the next person.
On number 6, Crack and Peel, did they provide the proof of purchase for the sound limiter?
Yes, they all provided proof of purchase. Thank you.
Okay. On number 12, and I have a similar concern on number 14, where we're indicating that they're going to have recorded and in one case live music, and they're open until 2 a.m. And especially at this time when most people are eating outdoors. I mean, how do we? And they're both located at the bottom of apartment buildings. How is that going to work out? This doesn't seem like a workable situation to me. And let me ask you, in addition, in the resolution for number 12, it says that they would be open Sunday through Monday from 2 p.m. to 2 a.m. Is that a typo? Are they only going to be open? Are they only going to be open one night?
The hours that stand correct will be the one on the minutes. So the minutes are the one that are correct.
All right. So how do we limit their music? so it doesn't go, it doesn't disturb the people who live upstairs.
If I read the minutes correctly, Steve, on number 12, and let me just double check here. They seem to be only playing ambient music for the most of the time. They just wanted to have that option. If I'm missing anything, Cindy or Leo, please jump in, but that's what I recall from this meeting.
Yeah, but shouldn't we tell them that they can't have live music, karaoke, recorded music past maybe 10 or 11 o'clock at night?
While COVID is in place, those restrictions will not allow anybody to have this type of events.
Okay, thank you, Steve. Next person.
All right, Liz.
Thank you. You heard a lot of testimony from my neighbors. I have really mixed feelings about Cloister Grill. I get that these are very difficult times and it's really hard to run a restaurant without a liquor license. They're trying to run a family restaurant. They don't have hookah. They don't have a lot of loud music. As places go, it's really not so bad. And their food is good, but the street is just incredibly narrow. Many of the traffic problems that you've heard about, not all of them are created by the restaurant. There are several other businesses that contribute to it, but most of it is by the restaurant. I think you can hear it in the background. I quite intentionally have left my audio on so that you get the full delight of what it is to live on Henshaw Street. I only wish that the restaurant were still open so that you could hear some of the related traffic. So I would encourage you to vote no or to abstain from this vote or to just not vote yes, because I don't think that's a benefit to this community. Similarly, Buddha, although I do not live over there, if I did, I would vote against it. I spend a fair amount of time sort of eyeballing what that location looks like, and I just don't think that's going to be a good addition to the neighborhood given the size of the place. And once again, that's all I got. Thank you.
Thank you, Liz.
Anyone else? Who's the next person?
Faye.
Yeah.
I quick one.
No, I'm sorry,
Hey.
brother. I can't do this.
No, I raised my hand and I didn't speak all night.
Same
Okay,
thing,
so-
Gerard. Same thing. There was an order. We're following the order.
No,
Faye.
I said that. I had my hands up. That's all.
I
Whatever
know.
I
I know.
I raised my hand too.
I know. I see you, Robin. Don't worry. There's a list here. Faye.
Yes, thank you. Good evening, everyone. Yeah, it's just a quick question, and this is about the item on the agenda, number 10 and number 11, and I didn't hear exactly what's going on with those items.
So we're not voting on agenda item 10 or 11 because they were withdrawn. We're not voting on them.
All right, thank you.
Thank you, Helen.
Okay. Now it was Robin.
I just want to say that we shouldn't judge people without knowing them. We need to give you the benefit of the doubt for those new merchants to open since the pandemic being crazy and we don't have no money. A lot of people being out of job, out of work. And why we place against this new merchant that reopen and give opportunity to people to make some money and pay rent. That's the only thing I can say.
Okay, thank you. Tanya.
Yeah, hi, thank you. I wanted to say, and I totally agree with what people are saying in terms of wanting to support businesses. The concern is that of how some of them go about it. One of the things that I've noticed is that people are having speakers outside and live performances and especially with the open restaurants and you have to wonder about the impact of that really being outside, right? So the performances, the music being outside as opposed to inside the restaurant itself, right? And so that's just one concern, and what can be done to sort of work with them on changing those sort of practices so that it's not so reverberating so much to the residents. But also I wonder, one of the things that I would like to see is a plan in terms of how, the new businesses are fitting in. Maybe we should have some sort of plan in terms of vision for the community, in terms of the types of businesses and how the businesses are sort of synthesizing together, what is the vision so that we have more of a mix and we, of businesses in the community, and like, what could that vision look like? There just be a plan, because we keep just like having all, clubs and clubs on top of clubs, right? It creates an imbalance in terms of the config. It creates an imbalance in terms of the configuration of the businesses in the community. And
Hello,
so
Catherine.
it's just something, I'm sorry, hello? It's just something to think about when we're talking about, the businesses in terms of in our community. I just like to have us have some sort of vision. And so we're just not just letting, anything happen. Thank you.
Tanya. Next up is Gerard.
Hi, good evening. So I just want to note that I share many of the concerns that many of the residents and board members express, not only about item 7, but of other establishments. So having said that, let me just share, on the committee, often many of us are conflicted because what we have going on in our community is a little unfair and disingenuous. We're actually holding businesses accountable for public safety issues, for behavior, poor behavior, inconsiderate behavior that's permitted by city leadership and community leadership. And many of our community just like look away from what's going on. So it is a little unfair to hold these businesses accountable for what's being permitted well outside their space. I just wanted to note that it's an inconsistency, and consistency is really good because it makes people feel like they're being treated fairly. And I think we should really strive for consistency and really hold the ones accountable for the issues that everybody's talking about tonight. And in most of the part, it's really not the businesses. It's all the parties, leadership, community, people in our community that have allowed and tolerated and in many ways encouraged by not addressing this type of behavior. That's what keeps people up late at night. People working hard and hiring people to work hard is not keeping people up at night or creating the issues people are talking about. They're valid issues. Everything everybody brought up is valid. I think we have to start looking in the direction of who is actually allowing this to occur. And it's not people that are working hard 12, 14-hour days. They may be contributing to it, but there's a lot more going on that's keeping people up at night. And it's mostly not those people working. Thank you.
Okay, Maria, it is your time now.
Yeah, that'll be the last one.
Yeah.
Oh,
Maria,
thank
there
you
you
so
go.
much. I was going to speak, and probably you all know how I am going to vote on this particular, licenses. But also I agree with Gerard that we need to look at the entire area where these businesses are located. This is for many years. I've been on the board for 100 years or something like that. Jimberlink quote me on that. But anyway, and we see the changes in our communities, and we don't need to penalize new businesses coming up here, but there is no factories coming to give employment to a lot of immigrants that were on the on the garment district. It seems that the only opportunities for businesses in our communities is bars and in front of churches and schools, and no one cares about it. And I know that we should not penalize the ownership of the businesses, but we all need to work. And I see all of you patronizing all these people, all these places that makes a lot of noise, that are misbehaving, and you then come to our board and then complain, and then community president says the community board members do this. We have to take some responsibility on what is happening in our community. So I am not for or against particular businesses, but I look around to see how my vote will count. Thank you.
Thank you all.
Thank you, Isidro. Thank you, Catherine, and thanks to each and every one of you who has expressed their opinions. We have a shot, an opportunity. That's democracy to disagree and vote for issues that may directly impact us or not so much directly. But whatever the case it is, this is our opportunity to voice our opinion and advisory opinion, for that matter, as to how we feel that some of these businesses contribute or not, according to our own belief system, to the betterment of our community or not. I would like to then to Barbara. Can you mute yourself?
I call a point of order very briefly. I believe it was Leo who said he thought that the complaints were probably construction noise. If you look at Beta, New York City, which is the official registration of all sorts of complaints, the majority of complaints on number 8 Buddha Bar were tens of thousands of noise complaints. And
Point of order, Mr. Chairman. This is not a point of order.
Okay, so
it was loud music and loud noise.
okay, Barbara.
Excuse me, this is not a point of order,
I-
and you must stop talking.
Okay, I already corrected her. Okay,
Thank
so Ozzy, roll call, which I think you already have,
Yeah.
and took our votes.
Okay. So first, I want to apologize that I did not apologize in the other roll call. I'm probably going to mispronounce your name. I'm sorry. I have an accent. English is my second language. We are not voting on item number 10 and 11. They were withdrawn at the meeting. And when you vote in terms of the negative resolutions, when you vote no to a negative resolution, you in disagreement with the resolution, you're voting against it. If you vote yes to a negative resolution, you vote with the committee recommendation. Just wanted to make sure that that's clear. Okay. I would like to get the no votes first. And I'm starting with Marielle Ali.
Yes to all.
Okay. Hold on. Okay. Richard Allman. Richard Allman?
Yeah, unmuted now. No on 8, yes on all the rest.
No on 8. Yes on all the rest. Okay. Francisco Alvarez, I don't think he's here. Mary Anderson?
No to 7 and 8, yes to the rest.
Okay, no to 7 and 8, yes to the rest. Hold on a second. Just a second, please. Glenys?
Yes to all.
Okay, yes to all. Wayne? Wayne Benjamin?
Yeah, I'm here. No to 7 and 8, yes to the rest.
Okay. Jim Berlin?
No to 4, 5, 6, 7, and 8.
4.
Yes to the rest.
No to 4, 5, 6, 7 and 8.
Right.
Yes to the rest.
Thank you.
Tanya?
No to 7, 8, yes to the rest.
No to 7 and 8. Yes to the rest. Daryl?
Yeah, I'm here.
Okay.
No to 7 and 8, yes to the rest.
No to 7 and 8. Yes to the rest. Nobles?
Thank you for your patience, OC, and your work. No to
Thank
7
you.
and 8. Yes to the rest, please.
No to 7 and 8. Yes to the rest. Robin?
No to 8, yes to the rest.
No to 8. Yes to the rest. Wildest Cruz?
Yes to all.
Okay. Yes to all. Gerard? Gerard?
Sorry. Abstain 8, yes to the all rest.
Okay, abstain to 8. Yes to the rest. Catherine?
Can you come back to me, please?
Sure.
Thank you.
Naisha? Naisha Diaz? Are you there? Okay, I'll get back to her. Domingo?
I abstain on 8 and yes to the.
I'm sorry, I couldn't hear you. You abstain on 8?
And yes to the rest.
And yes to the rest. Okay. Gabriela?
No to 7 and 8, yes to the rest.
No to 7 and 8. Yes to the rest. Ashley? Ashley Fernandez?
Hi, no to 7 and 8 and yes to the rest.
No to 7 and 8. Yes to the rest.
Thank you.
Sarah? Sarah Fisher?
Yes. Actually, no to 7 and 8. I abstain on 1, 4, 12, 13, and 14. And I vote yes on A, B, C, 2, 3, and 5.
Okay, can you please repeat it back to me? I have
9. Yeah, okay, I have a no on 7 and 8. I abstain on numbers 1, 4, 6, 12, 13, and 14. And I vote yes on A, B, C, 2, 3, 5, and 9.
Okay, so no for 7 and 8. You abstain on number 1, 4, 6, 12, 13, and 14.
Yes.
Okay.
I mean,
Faye?
sorry, correct.
Faye?
Yes, I'm with you. Yes to all, except for number 8, I will abstain.
Yes to all, and you abstain on number 8.
Correct. Thank you.
You're welcome. Barbara?
No on 7 and 8, yes to the rest.
No on 7 and 8. Yes to the rest.
Correct.
Mariella Graham?
No to 4, 7, 8, and 12, and yes to the rest.
No to 4, 7, 8, and 12. Yes to the rest.
Yep, thank you.
Juan Guzman, which I don't think is there. Miriam James, I don't think she's there. I'm sorry. Did I miss? No. Okay. Danielle?
No to number 2, yes to the rest.
No to number 2, yes to the rest. Leo?
I'm going to abstain to resolution number 1 for the traffic and transportation, and yes to the rest.
1 is not traffic and transportation. You mean A?
I'm sorry, resolution A, yes, and yes to the rest.
Okay, can you say it all over again? You abstain on A.
I abstain on A, and yes to everything else.
You abstain on A, and yes to everything else. Joseph?
Yes to everything except for 7, 8, and 12.
On which you vote?
No.
Yes on everything except 7, 8, and 12, on which you vote no.
Correct. Thank you.
I vote no on number 7 and 8, and yes to the rest. Patty Lehman?
I vote no on 7 and 8 and yes to the rest.
No on 7 and 8, and yes to the rest. Francisco Lopez?
Yes to everything.
Yes to all. Liz Ritter?
No on 7 and 8, yes to the rest.
No on 7 and 8, and yes to the rest. Maria Luna, please start with the nose.
It's gonna be very simple. One, you ready?
You start with a no, right?
Yes, yes, yes. Okay.
Okay.
No. 1, 4, 5, 6, 7, 8, 12, 13, 14. Yes to the rest.
What's left?
Okay, I'm just going to repeat it back to you, Maria.
Yes.
No to 1, 3.
No, 1, 4.
I'm sorry. No to 1, 4, 5, 6, 7, 8, 12, 13, 14, and yes to the rest.
Correct.
Okay, thank you. Cindy, I don't think she's there. Jay? Jay, can you hear me? I will get back to him. Isidro?
Abstaining on 8, number 8, yes to the rest.
Abstaining on
Number 8.
8, and yes to the rest. Ariel? Ariel Miranda?
Yes. Voting yes on everything, abstaining on 7 and 8.
What?
Abstaining on 7 and 8, and yes to the rest. Debbie?
Thank you, OC. I'm voting no on number 7. I am abstaining on number 8, and it's yes to the rest.
You're voting no on number 7, and you abstain on 8, and yes to the rest.
Thank you.
Jonathan?
Abstain on 8, yes to the rest.
Abstain on 8, and yes to the rest.
Right.
Aisha? I don't think she's there. Rosie?
Yes to all. Thank you.
Yes to all. Paradise?
No to 7
No.
and 8.
Hello, that is no on 7
I'm
and 8
sorry.
for
I'm
me.
sorry. I'm sorry. Can you please unmute yourself? Can you please mute yourself? Paradise, can you please repeat it? I'm sorry.
Yes, that's no to 7 and 8, and yes to the rest.
Curtis, she's asking
No.
for Paradise, not Curtis.
Paradise, can you please repeat that? I'm sorry.
No, it's fine. No to 7 and 8, yes to the rest.
Thank you. No to 7 and 8, and yes to the rest. Christina?
Hi, I'm abstaining from 7 and 8 and yes to the rest.
Abstaining on 7 and 8, and yes to the rest. Bruce?
No, 7 and 8, yes to the rest.
No on 7 and 8, and yes to the rest. Etta?
No to 7 and 8, yes to the rest.
No on 7 and 8, and yes to the rest. Steve? Steve Simon? Steve? We'll get back to him. Omar?
No to 7 and 8. Yes to the.
I didn't hear the other part. I heard no to 7 and 8.
Yes to the rest.
No to 7 and 8, and yes to the rest.
Correct.
Angel. Angel?
Yes to all.
Angel, yes to all. I don't think he's on the call. Curtis.
Once again, yes, excuse me, no to 7 and 8, and yes to the rest.
No to 7 and 8, and yes to the rest.
Correct.
Now I have to go back to, let's see, who couldn't hear me? Steve Simon.
Yeah, can you hear me now?
I can hear you now.
Okay, thank you. Not voting on number 5 due to conflict. This is a Parks Department concession, and I am an official of the Parks Department. Voting no on 7 and 8, abstaining on 12 and 14, voting yes on all others.
So you're not voting on number 5 due to conflict. You're voting no on number 7, 8, 12, and 14. And yes to the rest.
Well, abstaining on 12 and 14.
Okay, abstaining on 12 and 14. Yes to the rest.
Yes.
Okay. Let's see who else I missed. Oh.
Missing the chair.
Jay. I know, but he's going to be last. Jay, can you hear us?
Jay's no longer on the call.
Well, he was there, but I guess he's gone. Okay. Hold on a second. And I think Eli, but I want to make sure that
too. It's Catherine
I'm
Diaz.
sorry, you're right. You're absolutely right. Hold on a
Okay.
second. Catherine, go ahead.
So I abstain on 7, no on 8, and yes to the rest.
Abstain on 7, no on 8, and yes to the rest. Eli?
Abstain on 7 and 8, yes to the rest.
Abstain on 7 and 8,
Yes,
and yes to the rest.
correct.
And I think we're good.
We're good?
I think so. Did I miss anyone? Did I not call somebody that is now on call?
Guess not. Moving
I
forward.
guess not.
All
Okay.
right. 10:13. So we're gonna shorten our reporting time or reports time from 3 minutes to 2 minutes. So please just bear with me. If you can help us all and have us go back to your minutes, even better. I'm not asking for miracles. First one up is Mary Anderson. Unmute yourself. Unmute.
Got it.
There you go. Perfect.
Okay. Refer to the minutes. One thing I just wanted to let people know about those, that we're with our resolution, we're trying to maybe organize a press conference. So I'll be talking to you, Eli, more about that. And that's it.
Faye?
Thank you. Yes, well, I just want to make an announcement and refer to the minutes in that respect. But I just wanted to remind everybody that on the next Youth and Education Committee, we're going to have a joint meeting where we're going to have the homelessness and mental health youth crisis. We have a great panel so far. They are confirmed. It's going to be about like 6 panelists, and I hope that, you know, we can get your support. I also, and last, wanted to say that just to remember, like the Board of Presidents said, tomorrow for the NYPD community relations, this is highly important because we know that the board actually has supported youth and police building bridges. And although this is about reform, but it's important that we be consistent. And I think the board pretty much may at least is voucher for the idea of having good relationship. That's it. Thank you. Good night.
Thank you. Liz?
Hi, can you hear me?
Yes.
Okay, so read the minutes. I just want to let people know that the committee will be working on a street co-naming probably for next month. I'm pleased to report that several of our local cultural institutions are open for visits with strict COVID protocols. Dykeman House, the Cloisters, the Hispanic Society has a wonderful outdoor exhibit. And there's an incredible exhibit going to open next week at the Morris Jamel Mansion, an outdoor exhibit attached to the fence honoring those in our community who have died of COVID. It's called COVIDA. And lastly, there's a meeting on Thursday, this Thursday, October 29th at 6:30 p.m. On Zoom, a public scoping meeting for some improvements to Bennett Park and the central lawn, which will be made into AstroTurf courtesy of funding from Councilmember Rodriguez and Manhattan Borough President Gail Brewer. That's it.
Thanks again. Domingo?
I refer to the committee minutes. One thing we're trying to work on is being able to diversify perspectives within the committee. Sometimes it feels like the only businesses we have are restaurants, but yet some of the vast majority of our community is actually composed of hair salons and barbershops. So we'll be hosting several conversations throughout the months to be able to get perspectives from various business owners and key stakeholders within the community to be able to put together a resolution that we hope to be able to advise on potential ways of being able to salvage a lot of the impacts COVID has had on the small businesses within our community. Thank you.
Thanks, Domingo. Curtis?
Today, I'm going to refer you all to the minutes.
That was easy. Like the staples button. That was easy. Ariel Miranda.
Well, so this past month we focused on reviewing the budget items. As you'll see, we focus specifically on a few things such as affordable housing, ensuring that we are getting funding for some of the pantries after being suggested by our Health and Environment Committee Chair. We also put forward a few items focused on the inspections, both within residential buildings as well as the Department of Buildings, purview. We also put forward some focus on affordable housing or services being delivered specifically for the LGBTQ youth, our seniors, and specifically those that are at-risk families. If you have any questions on the items that we've put forward, please feel free to ask what now. Thank you.
Okay, Steve Simon.
Yes, I'm somewhat surprised that we were able to win that paper challenge, and I hope that we can continue to improve upon our record for recycling on residential paper, where in the past we've lagged behind. So hopefully we can continue to hold on to that record. My committee had a presentation from Resource Navigators at the Northern Manhattan Improvement Corporation. They provide a service in conjunction with the city's Test and Trace Corps program, in which they provide support for people in isolation, people who have the COVID-19, whether they're at home or in a hotel or someplace else. They'll help them obtain food, medication, diapers, and other items, essential items that they may need. They're working 7 days a week, 9 to 9. So far, they've helped over 1,500 people, about half of whom are from Washington Heights and Inwood. We have good news from the Isabella Geriatric Center. They have continued to not to have any more COVID-19 cases leading to any more deaths. And also good news, the Ryan Health Center has opened up a new facility, a very excellent healthcare program, now serving Washington Heights and Inwood on Wadsworth Avenue, just south of 181st Street. And they're open at this point, I believe, 5 days a week, Monday through Friday, maybe 9 to 5. Hopefully they'll expand their hours because they have an excellent program. And they're all over Manhattan, and now they're finally in our community as well.
Last but not least, Mr. Wayne Benjamin.
Thank you. So the October Land Use Committee meeting, we had a presentation concerning the National Register listing of the Fort Washington branch of the New York Public Library, an update on the proposed demolition of 857 Riverside Drive and construction of a new 13-story building, a briefing on a proposed Dominican Historic District, and we went through the Land Use Committee's expense and budget priorities. I refer you to the minutes for details on all of those, and I would also like to thank Borough President Brewer, whose office took the lead in drafting a letter to the Building Department and Department of City Planning, outlining the issues that were raised by the committee and neighborhood residents on the 857 Riverside project. That letter was signed onto by Councilmember Levine and State Senator Jackson and Assemblyman Al Taylor, as well as our own board chair. And we thank them all for working together to support the community in this matter. Sifan.
Okay. Any more? Anything? Wayne, is that it?
That's it.
We're so used to getting so much more.
Well, refer to the minutes. Refer to the minutes.
Great. So moving along, all business. I don't think that we have anything pending, except maybe for announcing our nominating committee, and then our results from our special assistant secretary elections. When our nominating committee likes just to point out that basically the work is to review the attendance, work closely with the secretary and our staff, mainly Paola Garcia, so that they can look closely at their attendance, look for any mishaps along the way, so that they can determine the eligibility of the candidates. We're planning to have a November 2nd Zoom meeting with Noel Hidalgo from Beta NYC, Jonathan Nunez as our IT person, our district manager, and Jim Berling as our parliamentarian. I want you guys to know that newly named committee members, nominating committee members, that you will be independent of the chair as far as anything that relates to the logistics and the procedures of the elections. And for that, you have a parliamentarian and a very experienced district manager that you're going to deal with. The person that we are going to be working as in our nominating committee is that the chairperson is going to be Nobles Crawford. Nobles Crawford is going to be the chair. We're going to have Ashley Fernandez, Robin Cruz, Chris Ventura, Mariel Ali, and Paris Phoenix. I'll say this next 6 names again. Chair, Nobles Crawford, Ashley Fernandez, Robin Cruz, Chris Ventura, Mariel Ali, and Paris Phoenix. That's going to be our nominating committee. Next one up, we are going to present to you guys the results of our just held elections. Ebenezer, if you're so kind, The results came from, again, www.opavote.com. And here they are. There were two, I think you just, okay, you want to open up the email. Okay, here they are. You guys can read them, or I can read them out loud. It says Community Board 12, Special Election Process Secretary. There were 2 candidates competing for 1 seat. The number of voters is 41, and there were 41 valid votes. Method absence, blah, 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 blah. Darrell Cochrane, 16 votes. Rosie Perez, 27 votes. Exhausted, 0 votes. Winner is Rosie Perez. Thank you, Ebenezer. Does anyone have any questions, so we can call the meeting for an adjournment?
I just want to say thank you for everyone, and I welcome. Hello, can you? Oh, and I welcome any suggestions, and I'm looking forward to putting in the work.
Thank you, Rosie. It wasn't,
Okay.
it wasn't the best
Eliezer.
of 2 choices.
Eliezer,
Yes, sir.
I don't know if we have the results of the votes on resolution 7 and 8.
I do.
Oh, you do?
Yeah, they did not pass.
All right, so I hope that the resolutions that we send to the SLA make it clear as to why the board is opposed to those 2 applications, that we just don't send the current text and say that those resolutions were defeated. I think we need to give the SLA some clear grounds upon which we based our vote. So I hope that those resolutions will be rewritten.
Thank you for stipulating that, Steve.
And I would also like to point out for the nominating committee that I believe that your job is more than just to check the attendance. Your job is to sift through who you believe are the best people to run for various offices. You should bring your own judgment to that and decide on who would serve the board the best, not just base it on who's what people's attendance records are and who's technically qualified to run. You should decide, even after somebody says they want to run for something, you should decide whether that makes sense. They can always be nominated from the floor, but I think we should be counting on you to help decide who are the best nominees.
I take local democracy very seriously and understood.
Thank you, Steve, for your pointed words.
And the bylaws say otherwise.
Okay.
No, they don't.
All right. I'd like to say, again, extend thank you, gratefulness to Gail for the work that she does throughout our community. I think it's commendable how she comes out and supports sometimes indefendable causes, but she's been a champion of our minority-owned businesses throughout the city, especially ours. Okay. So call the meeting for adjournment.
Seconded.
Second. Have a great night and thank you.
You too. Thank you. Bye.
Bye-bye.
Hi, guys.
Good night, everyone.